1. Introduction to blood electrification. 1.1 History of blood electrification. Blood electrification, also known as blood electrification therapy or electrification of the blood, is a therapeutic technique that involves the application of low-level electrical currents to the bloodstream. This alternative therapy has gained attention in recent years for its potential health benefits and has a fascinating history that dates back several decades. 1.1.1 Early experiments and discoveries. The concept of using electricity for medical purposes can be traced back to ancient civilizations, where electric fish were used to treat various ailments. However, the specific application of electricity to the blood began to take shape in the 19th century. One of the pioneers in this field was Dr. Robert O. Becker, an orthopedic surgeon and researcher. In the 1960s, Dr. Becker conducted experiments on the electrical properties of living tissues and discovered that electrical currents played a crucial role in the regeneration and healing of bones and tissues. This groundbreaking research laid the foundation for further exploration into the effects of electricity on the human body. 1.1.2 The work of Dr. Hulda Clark. Another influential figure in the history of blood electrification is Dr. Hulda Clark, a naturopathic doctor and author. In the 1990s, Dr. Clark developed a device called the Zapper, which she claimed could eliminate parasites and pathogens from the body using electrical frequencies. Dr. Clark's work sparked interest in the use of electricity for health purposes, including the electrification of the blood. She proposed that applying a small electrical current to the bloodstream could help eliminate pathogens, improve immune function, and promote overall wellness. 1.1.3 The Beck Protocol. One of the most well-known advocates of blood electrification is Dr. Robert C. Beck, a physicist and inventor. In the 1990s, Dr. Beck developed a protocol that involved the use of a blood electrification device, colloidal silver, magnetic pulsing, and ozonated water to support health and well-being. Dr. Beck's protocol gained popularity among individuals seeking alternative therapies and attracted attention from both the scientific community and the general public. His research and findings contributed significantly to the understanding and acceptance of blood electrification as a potential therapeutic modality. 1.1.4 Advancements in technology. Over the years, advancements in technology have led to the development of more sophisticated blood electrification devices. These devices are designed to deliver precise electrical currents to the bloodstream, making the therapy more accessible and convenient for users. Modern blood electrifiers often incorporate features such as adjustable current levels, programmable treatment protocols, and safety mechanisms to ensure optimal results and user safety. These advancements have made blood electrification more user-friendly and have expanded its potential applications in various health conditions. 1.1.5 Growing interest and research. As the field of alternative medicine continues to evolve, blood electrification has garnered increasing interest from researchers and healthcare professionals. Numerous studies have been conducted to explore the effects of electrical currents on blood cells, immune function, and overall health. While the scientific evidence supporting the efficacy of blood electrification is still evolving, preliminary research suggests that it may have potential benefits in immune system support, detoxification, pain relief, and circulation enhancement. However, further research is needed to fully understand the mechanisms of action and determine the optimal protocols for different health conditions. 1.1.6 Popularity and adoption. Blood electrification has gained popularity among individuals seeking alternative and complementary therapies. Many people have reported positive experiences and anecdotal evidence of improved health and well-being after incorporating blood electrification into their wellness routines. However, it is important to note that blood electrification should not be considered a replacement for conventional medical treatments. It is always advisable to consult with a qualified healthcare professional before starting any new therapy or making changes to existing treatment plans. In conclusion, the history of blood electrification is a fascinating journey that spans several decades. From early experiments and discoveries to the development of advanced devices and growing research, this alternative therapy continues to intrigue and captivate individuals seeking natural approaches to health and wellness. As the field progresses, it holds the potential to contribute to our understanding of the human body and its response to electrical currents, paving the way for new possibilities in healthcare. 1.2 Principles of blood electrification. Blood electrification is a therapeutic technique that involves the application of low-level electrical currents to the bloodstream. This process is based on the principle that electric currents can have a positive impact on the body's overall health and well-being. The principles of blood electrification revolve around the effects of electric currents on the blood and its various components. 1.2.1 Electromagnetic fields and blood. The human body is composed of trillions of cells, each with its own electrical charge. These charges create electromagnetic fields that are essential for the proper functioning of the body. Blood, being a vital fluid, is also influenced by these electromagnetic fields. When an external electric current is applied to the body, it interacts with the body's natural electromagnetic fields, affecting the blood in the process. 1.2.2 Effects of electric current on blood. When an electric current is applied to the blood, it creates a mild electrical charge within the plasma and the red and white blood cells. This charge alters the electrical properties of the blood, making it less prone to the growth and proliferation of pathogens such as bacteria, viruses, and fungi. Additionally, the electric current can enhance the movement and circulation of blood cells, improving oxygenation and nutrient delivery to various tissues and organs. 1.2.3 Electrolysis and blood electrification. Electrolysis is a process that occurs when an electric current passes through a liquid, causing the separation of its components. In the case of blood electrification, electrolysis plays a crucial role. The electric current applied to the blood causes the breakdown of water molecules, resulting in the release of negatively charged ions, such as oxygen and hydrogen. These ions can have antimicrobial properties and contribute to the overall health of the blood. 1.2.4 Mechanisms of action in blood electrification. Blood electrification works through several mechanisms of action. Firstly, the electric current disrupts the membrane potential of pathogens, making them less viable and inhibiting their ability to replicate. Secondly, the electric current stimulates the production of reactive oxygen species, ROS, within the blood, which can help neutralize harmful microorganisms. Lastly, the electric current enhances the movement of blood cells, improving their ability to carry oxygen and nutrients to tissues and remove waste products. 1.2.5 Research and studies on blood electrification. Over the years, numerous studies have been conducted to explore the effects and benefits of blood electrification. While the research is still ongoing, preliminary findings suggest that blood electrification may have potential therapeutic applications. Some studies have shown that blood electrification can enhance immune function, reduce inflammation, and improve overall well-being. However, more research is needed to fully understand the mechanisms and optimize the use of blood electrification. 1.2.6 Comparisons with other alternative therapies. Blood electrification is often compared to other alternative therapies that involve the use of electrical currents, such as electrotherapy and bioelectromagnetic therapy. While these therapies share similarities, blood electrification focuses specifically on the application of electric currents to the bloodstream. This targeted approach aims to improve the health and vitality of the blood, which can have a positive impact on the entire body. In conclusion, the principles of blood electrification revolve around the application of low-level electric currents to the bloodstream. By interacting with the body's natural electromagnetic fields, blood electrification can enhance the health and vitality of the blood. Through mechanisms such as electrolysis and the stimulation of reactive oxygen species, blood electrification may have potential benefits in supporting immune function, reducing inflammation, and improving overall well-being. Ongoing research and studies continue to explore the full potential of blood electrification as a therapeutic technique. 1.3 Benefits of blood electrification. Blood electrification is a therapeutic technique that involves the application of low-level electrical currents to the bloodstream. This innovative approach has gained attention for its potential health benefits and has been used as an alternative therapy for various conditions. While the scientific research on blood electrification is still evolving, there are several potential benefits associated with this practice. In this section, we will explore some of the potential benefits of blood electrification. 1.3.1 Enhanced immune function. One of the primary benefits of blood electrification is its potential to enhance immune function. The immune system plays a crucial role in defending the body against pathogens and maintaining overall health. By stimulating the immune system, blood electrification may help strengthen the body's natural defense mechanisms. Research suggests that blood electrification may increase the production of white blood cells, which are responsible for fighting off infections and diseases. Additionally, it may enhance the activity of natural killer cells, which play a vital role in identifying and destroying abnormal cells, including cancer cells. 1.3.2 Detoxification and cleansing. Another potential benefit of blood electrification is its ability to support detoxification and cleansing processes in the body. Toxins and impurities can accumulate in the bloodstream, leading to various health issues. Blood electrification may help facilitate the removal of these toxins by improving circulation and promoting the elimination of waste products. By enhancing blood flow and oxygenation, blood electrification may support the body's natural detoxification mechanisms, helping to remove harmful substances and promote overall well-being. 1.3.3 Pain relief and inflammation reduction. Blood electrification has also been associated with pain relief and inflammation reduction. Chronic pain and inflammation can significantly impact an individual's quality of life. Research suggests that blood electrification may help alleviate pain by stimulating the release of endorphins, which are natural pain-relieving chemicals produced by the body. Additionally, it may help reduce inflammation by modulating the immune response and promoting tissue healing. While further research is needed to fully understand the mechanisms behind these effects, blood electrification shows promise as a non-invasive and drug-free approach to managing pain and inflammation. 1.3.4 Improved circulation and oxygenation. Optimal blood circulation and oxygenation are essential for overall health and well-being. Blood electrification may help improve circulation by enhancing blood flow and preventing the formation of blood clots. By increasing the electrical charge of red blood cells, blood electrification may improve their ability to carry oxygen and nutrients to the body's tissues. This improved oxygenation can support cellular function and promote overall vitality. Additionally, enhanced circulation can aid in the removal of waste products and toxins from the body, further supporting detoxification processes. 1.3.5 Potential cancer support. While blood electrification should not be considered a standalone treatment for cancer, it may have potential as a supportive therapy. Some studies suggest that blood electrification may inhibit the growth of cancer cells and enhance the effectiveness of conventional cancer treatments. By increasing the electrical charge of cancer cells, blood electrification may disrupt their metabolism and inhibit their ability to proliferate. However, it is important to note that more research is needed in this area to fully understand the potential benefits and limitations of blood electrification in cancer treatment. 1.3.6 Stress reduction and relaxation. Chronic stress can have a detrimental impact on both physical and mental health. Blood electrification may help reduce stress and promote relaxation by stimulating the release of endorphins and promoting a sense of well-being. Additionally, the gentle electrical currents used in blood electrification may have a calming effect on the nervous system, helping to alleviate anxiety and promote a state of relaxation. By reducing stress levels, blood electrification may contribute to overall mental and emotional well-being. 1.3.7 Enhanced energy and vitality. Many individuals report increased energy and vitality after incorporating blood electrification into their wellness routine. By improving circulation, oxygenation, and immune function, blood electrification may help boost energy levels and promote a sense of vitality. Additionally, the potential pain-relieving effects of blood electrification may contribute to increased physical activity and overall well-being. While individual experiences may vary, blood electrification has the potential to support overall energy levels and enhance vitality. In conclusion, blood electrification holds promise as an alternative therapy with several potential benefits. From enhancing immune function and supporting detoxification to reducing pain and inflammation, blood electrification may offer a range of advantages for individuals seeking natural and non-invasive approaches to health and well-being. While further research is needed to fully understand the mechanisms and effectiveness of blood electrification, it is an area of growing interest in the field of alternative medicine. As with any therapeutic approach, it is important to consult with a healthcare professional before incorporating blood electrification into your wellness routine. 1.4 Safety considerations in blood electrification. When it comes to any form of alternative therapy, safety should always be a top priority. Blood electrification is no exception. While this therapy has gained popularity for its potential health benefits, it is crucial to understand and follow safety guidelines to ensure a safe and effective experience. In this section, we will explore the safety considerations associated with blood electrification. 1.4.1 Understanding electrical safety. Before delving into the specifics of blood electrification, it is essential to have a basic understanding of electrical safety. Electricity can be dangerous if not handled properly, and it is crucial to take necessary precautions to prevent accidents or injuries. When using a blood electrifier, it is important to ensure that the device is in good working condition and properly maintained. Regularly check for any signs of damage or wear and tear. If you notice any issues, it is advisable to contact the manufacturer or a qualified technician for assistance. Additionally, it is crucial to follow the manufacturer's instructions regarding the use of the device. This includes understanding the appropriate voltage, current, and duration of treatment. Using the device outside of the recommended parameters can increase the risk of adverse effects. 1.4.2 Electrode placement and skin safety. Proper electrode placement is essential for effective blood electrification. However, it is equally important to consider skin safety during the process. The electrodes should be placed on clean, dry skin to ensure good contact and minimize the risk of skin irritation or burns. Before applying the electrodes, it is advisable to clean the skin thoroughly with mild soap and water. This helps remove any dirt, oils, or lotions that may interfere with the electrical conductivity. After cleaning, ensure that the skin is completely dry before attaching the electrodes. During the treatment, it is important to monitor the skin for any signs of redness, irritation, or discomfort. If you experience any adverse reactions, such as itching or burning sensations, it is recommended to discontinue the treatment and consult a healthcare professional. 1.4.3 Individual variations and precautions. Every individual is unique, and their response to blood electrification may vary. It is important to consider certain precautions and individual variations to ensure a safe experience. Firstly, pregnant women should exercise caution when considering blood electrification. While there is limited research on the effects of blood electrification during pregnancy, it is advisable to consult with a healthcare professional before using the therapy. Individuals with pacemakers or other implanted electronic devices should also exercise caution. The electrical currents used in blood electrification may interfere with the functioning of these devices. It is crucial to consult with a healthcare professional and the manufacturer of the implanted device before using a blood electrifier. Furthermore, individuals with epilepsy or a history of seizures should consult with a healthcare professional before using blood electrification. The electrical currents used in the therapy may potentially trigger seizures in susceptible individuals. 1.4.4 Hygiene and infection control. Maintaining proper hygiene and infection control is essential during blood electrification. It is important to ensure that all equipment, including the electrodes, is clean and sterilized before each use. This helps prevent the risk of infection or cross-contamination. Follow the manufacturer's instructions for cleaning and sterilizing the electrodes. If disposable electrodes are used, ensure that they are properly disposed of after each treatment session. If reusable electrodes are used, clean them thoroughly with an appropriate disinfectant solution and allow them to dry completely before the next use. Additionally, it is important to avoid sharing blood electrification devices with others. Each individual should have their own set of electrodes to prevent the transmission of infections. 1.4.5 Monitoring and adverse effects. During blood electrification, it is important to monitor your body's response and be aware of any adverse effects. While blood electrification is generally considered safe, some individuals may experience mild side effects. Common side effects may include mild dizziness, fatigue, or a tingling sensation at the electrode site. These effects are usually temporary and subside shortly after the treatment. However, if you experience severe or persistent side effects, it is advisable to discontinue the treatment and seek medical attention. Regular monitoring of your overall health is also important. If you notice any unexpected changes or worsening of symptoms, it is recommended to consult with a healthcare professional. 1.4.6 Consultation with healthcare professionals. Before starting blood electrification or any alternative therapy, it is always advisable to consult with a healthcare professional. They can provide guidance based on your individual health condition and help determine if blood electrification is suitable for you. Healthcare professionals can also offer valuable insights and recommendations regarding the safe and effective use of blood electrification. They can help address any concerns or questions you may have, ensuring that you have a well-informed approach to your health. In conclusion, while blood electrification has shown potential benefits, it is crucial to prioritize safety during the process. Understanding electrical safety, proper electrode placement, individual variations, hygiene, monitoring, and consultation with healthcare professionals are all important considerations to ensure a safe and effective blood electrification experience. By following these guidelines, you can maximize the potential benefits of this therapy while minimizing any potential risks. 2. Understanding the human blood. 2.1 Composition of blood. Blood is a vital fluid that circulates throughout our bodies, delivering essential nutrients, oxygen, hormones, and immune cells to various organs and tissues. It plays a crucial role in maintaining homeostasis and ensuring the proper functioning of our bodily systems. Understanding the composition of blood is fundamental to comprehending the science behind blood electrification and its potential benefits. 2.1.1 Plasma. Plasma is the liquid component of blood, accounting for approximately 55% of its total volume. It is a yellowish fluid composed mainly of water, electrolytes, proteins, hormones, and waste products. Plasma serves as a medium for transporting various substances, including nutrients, hormones, and waste materials, throughout the body. It also plays a vital role in maintaining blood pressure and pH balance. 2.1.2 Red blood cells, erythrocytes. Red blood cells, also known as erythrocytes, are the most abundant cells in the blood. They make up about 40–45% of the total blood volume. These specialized cells contain a protein called hemoglobin, which binds to oxygen and carries it from the lungs to the body's tissues. Red blood cells also help remove carbon dioxide, a waste product of cellular metabolism, and transport it back to the lungs for elimination. 2.1.3 White blood cells, leukocytes. White blood cells, or leukocytes, are a crucial component of the immune system. They make up a small fraction of the total blood volume, accounting for about 1% of the blood. There are several types of white blood cells, each with its unique function in defending the body against infections and foreign invaders. Some white blood cells engulf and destroy pathogens, while others produce antibodies to neutralize harmful substances. 2.1.4 Platelets, thrombocytes. Platelets, or thrombocytes, are small cell fragments that play a vital role in blood clotting. They are responsible for forming a plug at the site of a damaged blood vessel, preventing excessive bleeding. When a blood vessel is injured, platelets adhere to the damaged area and release chemicals that initiate the clotting process. This process involves the formation of a fibrin mesh, which traps red blood cells and forms a clot to stop bleeding. 2.1.5 Other components. In addition to plasma, red blood cells, white blood cells, and platelets, blood also contains various other components that contribute to its overall composition and function. These include electrolytes. Blood contains a variety of electrolytes, including sodium, potassium, calcium, magnesium, chloride, and bicarbonate. These ions play essential roles in maintaining fluid balance, pH regulation, nerve function, and muscle contraction. Nutrients. Blood carries essential nutrients, such as glucose, amino acids, fatty acids, vitamins, and minerals, to the body's cells. These nutrients are necessary for energy production, growth, repair, and overall cellular function. Hormones. Blood transports hormones produced by various glands throughout the body. Hormones act as chemical messengers, regulating numerous physiological processes, including metabolism, growth, reproduction, and stress response. Waste products. Blood carries waste products, such as carbon dioxide and urea, to the organs responsible for their elimination, such as the lungs and kidneys. These waste products are byproducts of cellular metabolism and need to be removed from the body to maintain proper functioning. Enzymes. Blood contains various enzymes that facilitate biochemical reactions in the body. These enzymes play a crucial role in digestion, metabolism, and other physiological processes. Understanding the composition of blood provides a foundation for comprehending the mechanisms and potential benefits of blood electrification. By applying electrical currents to the blood electrification devices aim to influence the behavior and function of its components, potentially leading to various health benefits. In the following chapters, we will explore the principles, applications, and safety considerations of blood electrification in more detail. 2.2 Functions of blood. Blood is a vital fluid that plays a crucial role in maintaining the overall health and functioning of the human body. It serves a multitude of functions, each of which is essential for our survival and well-being. In this section, we will explore the various functions of blood and gain a deeper understanding of its significance. 2.2.1 Oxygen and nutrient transport. One of the primary functions of blood is to transport oxygen and nutrients to all the cells and tissues in the body. Oxygen is necessary for cellular respiration, the process by which cells produce energy. Blood carries oxygen from the lungs, where it is inhaled, to the rest of the body. Additionally, blood transports nutrients, such as glucose, amino acids, and fatty acids, derived from the digestion of food, to the cells where they are needed for growth, repair, and energy production. 2.2.2 Removal of waste products. In addition to delivering oxygen and nutrients, blood also plays a crucial role in removing waste products from the body. As cells carry out their metabolic processes, they produce waste substances such as carbon dioxide and metabolic byproducts. Blood collects these waste products and transports them to the organs responsible for their elimination, such as the lungs for carbon dioxide and the kidneys for filtering out metabolic waste and excess water. 2.2.3 Regulation of body temperature. Blood helps regulate body temperature by distributing heat throughout the body. When the body is exposed to cold temperatures, blood vessels in the skin constrict, reducing blood flow to the surface and conserving heat. Conversely, in hot conditions, blood vessels dilate, allowing more blood to flow near the skin's surface, promoting heat loss through sweating and cooling the body. 2.2.4 Immune system function. Blood plays a vital role in the body's immune response, which defends against harmful pathogens and foreign substances. It contains white blood cells, which are responsible for identifying and destroying invading microorganisms, such as bacteria and viruses. Additionally, blood carries antibodies, proteins that recognize and neutralize specific antigens, providing immunity against diseases. 2.2.5 Clotting and wound healing. Blood contains platelets, specialized cells that play a crucial role in clotting and wound healing. When a blood vessel is damaged, platelets quickly gather at the site to form a clot, preventing excessive bleeding. This clotting process is essential for the body to repair and heal wounds, ensuring that the integrity of blood vessels is maintained. 2.2.6 Picohenries and electrolyte balance. Blood helps maintain the body's pH balance, which is the measure of acidity or alkalinity. It contains buffers that regulate the pH by absorbing excess hydrogen ions or releasing them when needed. Additionally, blood maintains the balance of electrolytes, such as sodium, potassium, calcium, and magnesium, which are essential for proper cell function and nerve signaling. 2.2.7 Hormone transport. Hormones are chemical messengers that regulate various bodily functions. Blood acts as a transport system for hormones, carrying them from the endocrine glands, where they are produced, to their target organs or tissues. This allows hormones to exert their effects and regulate processes such as metabolism, growth, reproduction, and mood. 2.2.8 Blood pressure regulation. Blood plays a crucial role in regulating blood pressure, which is the force exerted by blood against the walls of blood vessels. Blood pressure is essential for maintaining proper circulation and ensuring that oxygen and nutrients reach all parts of the body. Specialized cells in the blood vessels, called baroreceptors, detect changes in blood pressure and send signals to the brain, which then adjusts the heart rate and blood vessel diameter to maintain optimal blood pressure levels. 2.2.9 Acid-base balance. Blood helps maintain the body's acid-base balance, which is the equilibrium between acids and bases in the body fluids. It contains bicarbonate ions, which act as a buffer to neutralize excess acids or bases, ensuring that the pH remains within a narrow range. This balance is crucial for the proper functioning of enzymes and other biochemical processes in the body. 2.2.10 Blood cell production. Within the bone marrow, blood is responsible for the production of various types of blood cells. Red blood cells, also known as erythrocytes, carry oxygen throughout the body. White blood cells, or leukocytes, are involved in the immune response. Platelets, as mentioned earlier, are essential for clotting and wound healing. Blood cell production is a continuous process that ensures an adequate supply of these cells for optimal bodily functions. In conclusion, blood serves a multitude of functions that are vital for our overall health and well-being. From oxygen and nutrient transport to waste removal, immune system function, clotting, hormone transport, and pH regulation, blood plays a crucial role in maintaining the balance and proper functioning of our body systems. Understanding the functions of blood helps us appreciate its significance and highlights the importance of maintaining its health and integrity. 2.3 Blood disorders and diseases. Blood disorders and diseases encompass a wide range of conditions that affect the components and functions of the blood. These conditions can arise from various factors, including genetic mutations, infections, autoimmune reactions, nutritional deficiencies, and exposure to toxins. Understanding the different types of blood disorders and diseases is crucial for comprehending the potential benefits of blood electrification in managing and improving these conditions. 2.3.1 Anemia. Anemia is one of the most common blood disorders, characterized by a decrease in the number of red blood cells or a deficiency in hemoglobin, the protein responsible for carrying oxygen throughout the body. This condition can result from various causes, such as iron deficiency, vitamin B12 deficiency, chronic diseases, or genetic disorders. Symptoms of anemia may include fatigue, weakness, shortness of breath, pale skin, and dizziness. Blood electrification has shown promise in supporting individuals with anemia. By enhancing circulation and oxygenation, blood electrification can potentially improve the delivery of oxygen to tissues and organs, thereby alleviating symptoms associated with anemia. However, it is important to consult with a healthcare professional to determine the underlying cause of anemia and develop a comprehensive treatment plan. 2.3.2 Hemophilia. Hemophilia is a rare genetic disorder characterized by the inability of the blood to clot properly. This condition is primarily caused by a deficiency or dysfunction of specific clotting factors in the blood. Individuals with hemophilia may experience prolonged bleeding, easy bruising, joint pain, and, in severe cases, spontaneous bleeding. While blood electrification may not directly address the underlying cause of hemophilia, it can potentially support overall health and well-being. By improving circulation and immune system function, blood electrification may aid in the prevention of infections and promote faster healing of wounds. However, it is crucial for individuals with hemophilia to work closely with their healthcare team to manage their condition effectively. 2.3.3 Leukemia. Leukemia is a type of cancer that affects the blood and bone marrow, leading to the abnormal production of white blood cells. These abnormal cells crowd out healthy blood cells, impairing the body's ability to fight infections and carry oxygen. Symptoms of leukemia may include fatigue, frequent infections, easy bruising or bleeding, weight loss, and swollen lymph nodes. While blood electrification is not a standalone treatment for leukemia, it may have a supportive role in managing the symptoms and improving overall well-being. By enhancing immune system function and promoting detoxification, blood electrification can potentially aid in the body's natural defense against cancer cells and support the effectiveness of conventional treatments such as chemotherapy or radiation therapy. However, it is essential for individuals with leukemia to consult with their oncologist to determine the most appropriate treatment approach. 2.3.4 Thrombocytopenia. Thrombocytopenia is a condition characterized by a low platelet count in the blood. Platelets are essential for blood clotting, and a deficiency in these cells can lead to excessive bleeding and difficulty in forming clots. Thrombocytopenia can be caused by various factors, including autoimmune disorders, infections, medications, and certain cancers. While blood electrification may not directly address the underlying cause of thrombocytopenia, it can potentially support overall blood health and immune system function. By improving circulation and promoting a balanced immune response, blood electrification may aid in reducing the risk of infections and supporting the body's natural healing processes. However, it is crucial for individuals with thrombocytopenia to work closely with their healthcare team to manage their condition effectively and monitor their platelet levels. 2.3.5 Sickle cell disease. Sickle cell disease is a genetic disorder characterized by the presence of abnormal hemoglobin, causing red blood cells to become rigid and assume a sickle shape. These abnormal cells can get stuck in blood vessels, leading to pain, organ damage, and an increased risk of infections. Symptoms of sickle cell disease may include fatigue, pain episodes, jaundice, delayed growth, and frequent infections. While blood electrification may not directly address the underlying genetic mutation causing sickle cell disease, it can potentially support overall blood health and circulation. By improving oxygenation and promoting immune system function, blood electrification may aid in reducing the frequency and severity of pain episodes and supporting the body's natural healing processes. However, it is important for individuals with sickle cell disease to work closely with their healthcare team to manage their condition effectively and receive appropriate medical interventions. In conclusion, blood disorders and diseases encompass a wide range of conditions that can significantly impact an individual's health and well-being. While blood electrification may not be a standalone treatment for these conditions, it has the potential to support overall blood health, circulation, and immune system function. However, it is crucial for individuals with blood disorders and diseases to work closely with their healthcare team to develop a comprehensive treatment plan that addresses their specific needs and incorporates appropriate medical interventions. 2.4 Role of blood in overall health. The human blood plays a vital role in maintaining overall health and well-being. It is a complex and dynamic fluid that circulates throughout the body, delivering essential nutrients, oxygen, hormones, and immune cells to various organs and tissues. Understanding the role of blood in overall health is crucial to comprehend the significance of blood electrification as a therapeutic approach. 2.4.1 Oxygenation and nutrient delivery. One of the primary functions of blood is to transport oxygen from the lungs to every cell in the body. Oxygen is essential for cellular respiration, the process by which cells convert nutrients into energy. Without adequate oxygenation, cells cannot function optimally, leading to fatigue, weakness, and a compromised immune system. In addition to oxygen, blood also carries nutrients derived from the food we consume. These nutrients, including carbohydrates, proteins, fats, vitamins, and minerals, are essential for the growth, repair, and maintenance of tissues and organs. The efficient delivery of oxygen and nutrients by the blood is crucial for the overall health and proper functioning of the body. 2.4.2 Waste removal and detoxification. Apart from delivering oxygen and nutrients, blood also plays a vital role in removing waste products and toxins from the body. As cells carry out their metabolic processes, waste products such as carbon dioxide and metabolic byproducts accumulate. The blood collects these waste products and transports them to the lungs and kidneys for elimination. The liver, kidneys, and lymphatic system are responsible for detoxifying the blood by filtering out harmful substances and metabolizing them for excretion. Blood electrification can support the body's natural detoxification processes by enhancing circulation and promoting the elimination of toxins. 2.4.3 Immune system function. The blood is a crucial component of the immune system, which defends the body against pathogens, foreign invaders, and abnormal cells. It contains various types of immune cells, including white blood cells, leukocytes, which play a vital role in identifying and destroying harmful substances. White blood cells are responsible for recognizing and neutralizing bacteria, viruses, fungi, and other pathogens. They also play a crucial role in identifying and eliminating abnormal cells, such as cancer cells. Blood electrification has been shown to enhance immune system function by increasing the activity of white blood cells and promoting a more robust immune response. 2.4.4 Regulation of body temperature. Blood also plays a significant role in regulating body temperature. It helps maintain a stable internal temperature by absorbing and distributing heat throughout the body. When the body is exposed to cold temperatures, blood vessels constrict to reduce heat loss and keep vital organs warm. Conversely, in hot conditions, blood vessels dilate to promote heat dissipation through the skin, helping to cool the body down. The regulation of body temperature is crucial for maintaining optimal physiological function. Blood electrification can support this process by improving circulation and ensuring efficient heat distribution throughout the body. 2.4.5 Hormone transport. Hormones are chemical messengers that regulate various bodily functions, including metabolism, growth, reproduction, and mood. They are produced by various glands and organs and released into the bloodstream, where they travel to target tissues and organs to exert their effects. The blood acts as a carrier for hormones, ensuring their efficient transport to their intended destinations. Hormonal balance is essential for overall health, and any disruption in hormone levels can lead to various health issues. Blood electrification can help support hormonal balance by improving circulation and facilitating the transport of hormones throughout the body. 2.4.6 Picohenry's balance and acid-base regulation. The blood plays a crucial role in maintaining the body's pH balance, which refers to the acidity or alkalinity of bodily fluids. The body functions optimally within a narrow pH range, and any significant deviation can disrupt normal physiological processes. The blood contains buffers that help regulate pH by neutralizing excess acids or bases. This acid-base balance is essential for the proper functioning of enzymes, hormones, and other biochemical reactions in the body. Blood electrification can support pH balance by improving circulation and enhancing the body's natural buffering capacity. 2.4.7 Overall health and well-being. Given the vital functions of blood in the body, its role in overall health and well-being cannot be overstated. Blood electrification aims to optimize blood function by improving circulation, enhancing immune system function, supporting detoxification, and promoting overall vitality. By understanding the role of blood in overall health, we can appreciate the potential benefits of blood electrification as a complementary therapy. It offers a non-invasive and natural approach to support the body's innate healing mechanisms and promote optimal health and well-being. 3. The science behind blood electrification. 3.1 Electromagnetic fields and blood. Electromagnetic fields, EMFs, are a fundamental aspect of our modern world. They are generated by various sources such as power lines, electrical appliances, and wireless communication devices. While the effects of EMFs on human health are still a topic of debate and ongoing research, there is growing interest in understanding the interaction between electromagnetic fields and the human body, including the blood. The human body is a complex system that relies on the flow of electricity for various physiological processes. Blood, being a vital component of this system, plays a crucial role in transporting oxygen, nutrients, hormones, and immune cells throughout the body. It is composed of red and white blood cells, plasma, and platelets, each with its own unique functions. When exposed to electromagnetic fields, the blood may undergo certain changes due to the interaction between the electromagnetic waves and the charged particles within the blood. These changes can occur at both the cellular and molecular levels, potentially influencing the overall health and well-being of an individual. One of the primary effects of electromagnetic fields on blood is the alteration of its electrical properties. Blood contains charged particles, such as ions, which can be influenced by external electric fields. When exposed to EMFs, these charged particles may experience movement or redistribution, leading to changes in the electrical conductivity of the blood. Research has shown that exposure to certain types of electromagnetic fields can affect the aggregation and deformability of red blood cells. Aggregation refers to the clumping together of red blood cells, which can impair their ability to flow smoothly through the blood vessels. Deformability, on the other hand, refers to the ability of red blood cells to change shape and squeeze through narrow capillaries. Changes in these properties can impact blood flow and oxygen delivery to tissues. Furthermore, electromagnetic fields have been found to influence the production and activity of white blood cells, which are essential for the immune response. Studies have shown that exposure to EMFs can modulate the release of cytokines, which are signaling molecules involved in immune regulation. This modulation may have implications for immune function and the body's ability to defend against infections and diseases. In addition to these cellular effects, electromagnetic fields can also influence the coagulation and clotting processes in the blood. Research suggests that exposure to certain types of EMFs can alter the activity of platelets, which are responsible for blood clot formation. Changes in platelet function can affect the risk of thrombosis, a condition characterized by the formation of blood clots that can lead to serious health complications. While the exact mechanisms by which electromagnetic fields interact with blood are still being investigated, these findings highlight the potential impact of EMFs on blood physiology. Blood electrification, as a therapeutic approach, aims to harness the beneficial effects of controlled electromagnetic fields on blood to promote health and well-being. It is important to note that the effects of electromagnetic fields on blood are highly dependent on various factors, including the frequency, intensity, and duration of exposure. Different types of electromagnetic fields, such as direct current DC and pulsed electromagnetic fields (PEMF), may have different effects on blood properties. Therefore, it is crucial to consider these factors when designing and using blood electrification devices. In the following sections, we will explore the specific effects of electric current on blood, the process of electrolysis in blood electrification, the underlying mechanisms of action, and the existing research and studies on blood electrification. We will also compare blood electrification with other alternative therapies to provide a comprehensive understanding of this emerging field. 3.2 Effects of electric current on blood. Electricity has been used for various medical purposes for centuries, and blood electrification is one such application that has gained attention in recent years. The effects of electric current on blood are multifaceted and can have both positive and negative impacts on the body. In this section, we will explore the different effects of electric current on blood and how they contribute to the overall benefits of blood electrification. 3.2.1 Electrolysis and blood electrification. One of the primary effects of electric current on blood is electrolysis. Electrolysis is the process of breaking down a compound into its constituent elements using an electric current. In the case of blood electrification, electrolysis occurs when the electric current passes through the blood, causing the separation of water molecules into hydrogen and oxygen ions. The production of hydrogen and oxygen ions through electrolysis has several beneficial effects on the blood. Hydrogen ions act as powerful antioxidants, helping to neutralize harmful free radicals in the body. This antioxidant effect can help reduce oxidative stress and inflammation, which are often underlying factors in many chronic diseases. Oxygen ions, on the other hand, contribute to the oxygenation of the blood. By increasing the availability of oxygen in the blood, blood electrification can enhance cellular respiration and improve overall energy production in the body. This increased oxygenation can have a positive impact on various bodily functions, including metabolism, immune response, and tissue repair. 3.2.2 Blood pH balance. Another important effect of electric current on blood is its ability to influence the pH balance. The pH level of the blood is a measure of its acidity or alkalinity, and maintaining a proper pH balance is crucial for optimal health. Blood electrification can help restore and maintain the ideal pH balance by influencing the ionization of various compounds in the blood. When an electric current passes through the blood, it can alter the ionization of substances such as bicarbonate ions, which play a significant role in regulating blood pH. By modulating the ionization of these substances, blood electrification can help restore the blood's pH balance to a more alkaline state, which is generally considered healthier. Maintaining an alkaline pH in the blood can have several benefits, including improved immune function, enhanced detoxification processes, and increased cellular energy production. It can also create an unfavorable environment for pathogens, making it more difficult for harmful bacteria and viruses to thrive. 3.2.3 Blood circulation and microcirculation. Electric current has a direct impact on blood circulation and microcirculation, which refers to the flow of blood through the smallest blood vessels, such as capillaries. When an electric current is applied to the blood, it can stimulate the movement of red blood cells and improve blood flow. Improved blood circulation is essential for delivering oxygen and nutrients to all parts of the body and removing waste products. By enhancing blood flow, blood electrification can help optimize cellular function and support the overall health of various organs and tissues. Furthermore, the stimulation of microcirculation through blood electrification can have additional benefits. It can promote the formation of new blood vessels, improve tissue oxygenation, and enhance the body's natural healing processes. This effect is particularly beneficial for individuals with conditions such as diabetic neuropathy, where impaired microcirculation can lead to tissue damage and slow wound healing. 3.2.4 Immune system modulation. The immune system plays a crucial role in defending the body against pathogens and maintaining overall health. Electric current has been shown to have immunomodulatory effects, meaning it can influence the activity and function of immune cells. Blood electrification can stimulate the production and activity of immune cells, such as lymphocytes and macrophages, which are responsible for identifying and eliminating foreign invaders. By enhancing immune cell function, blood electrification can strengthen the body's defense mechanisms and improve its ability to fight off infections and diseases. Additionally, the antioxidant effects of blood electrification, as mentioned earlier, can further support immune function. By reducing oxidative stress and inflammation, blood electrification can help create a more favorable environment for immune cells to operate efficiently. 3.2.5 Blood viscosity and platelet aggregation. Electric current can also influence the viscosity of blood, which refers to its thickness or resistance to flow. High blood viscosity can impair circulation and increase the risk of cardiovascular diseases. Blood electrification has been shown to reduce blood viscosity, making it easier for blood to flow through the vessels. Furthermore, electric current can affect platelet aggregation, which is the clumping together of platelets in the blood. Excessive platelet aggregation can lead to the formation of blood clots, which can block blood flow and cause serious health complications. Blood electrification has been found to inhibit platelet aggregation, reducing the risk of clot formation and improving overall cardiovascular health. In conclusion, the effects of electric current on blood are diverse and contribute to the overall benefits of blood electrification. From electrolysis and pH balance modulation to improved circulation, immune system modulation, and reduced blood viscosity, blood electrification offers a holistic approach to enhancing health and well-being. Understanding these effects can help individuals make informed decisions about incorporating blood electrification into their wellness routines. 3.3 Electrolysis and blood electrification. Electrolysis is a fundamental process that occurs in various chemical reactions and plays a crucial role in blood electrification. In the context of blood electrification, electrolysis refers to the decomposition of substances in the blood through the application of an electric current. This process is essential for the therapeutic effects of blood electrification devices. 3.3.1 Understanding electrolysis. Electrolysis involves the movement of ions in a solution under the influence of an electric current. In the case of blood electrification, the electrolysis process occurs when the electrodes of a blood electrifier are placed in contact with the skin, allowing the electric current to pass through the blood. The electric current causes the water molecules in the blood to split into hydrogen, H+, and hydroxide, OH ions. This splitting of water molecules is known as water electrolysis. The hydrogen ions, H+, are attracted to the negatively charged electrode, cathode, while the hydroxide ions, OH, are attracted to the positively charged electrode, anode. 3.3.2 Effects of electrolysis in blood electrification. The electrolysis process in blood electrification has several important effects on the blood. These effects contribute to the therapeutic benefits of blood electrification and help support overall health and well-being. 3.3.2.1 Picohenry's balancing. One of the significant effects of electrolysis in blood electrification is the balancing of pH levels in the blood. The splitting of water molecules during electrolysis releases hydrogen ions, H+, which can help neutralize excess acidity in the blood. This process can be particularly beneficial for individuals with conditions related to acidosis or imbalanced pH levels. 3.3.2.2 Oxygen release. Electrolysis also facilitates the release of oxygen in the blood. The splitting of water molecules generates oxygen molecules, O2, at the anode. These oxygen molecules can then dissolve into the blood, enhancing oxygenation and supporting cellular respiration. Improved oxygenation can have positive effects on overall health, energy levels, and cognitive function. 3.3.2.3 Microbial inhibition. The electrolysis process in blood electrification can also have antimicrobial effects. The release of hydrogen ions, H+, at the cathode creates an environment with increased acidity, which can inhibit the growth of certain microorganisms. This antimicrobial effect can be beneficial in supporting the body's natural defense mechanisms and promoting a healthy microbial balance. 3.3.2.4 Detoxification. Electrolysis in blood electrification can aid in the detoxification process. The electric current passing through the blood can help break down and eliminate toxins and waste products present in the bloodstream. This detoxification effect can support the body's natural detoxification pathways and contribute to overall well-being. 3.3.3 Electrolysis and cellular health. The electrolysis process in blood electrification not only affects the blood but also has implications for cellular health. The balanced pH levels, increased oxygenation, and detoxification facilitated by electrolysis can promote optimal cellular function and support various physiological processes. 3.3.3.1 Cellular energy production. Balanced pH levels and improved oxygenation resulting from electrolysis can enhance cellular energy production. Cells require a slightly alkaline environment and sufficient oxygen to produce energy efficiently. By promoting these conditions, blood electrification can support cellular metabolism and energy production, contributing to overall vitality. 3.3.3.2 Cellular communication and signaling. Electrolysis in blood electrification can also influence cellular communication and signaling. The balanced pH levels and improved oxygenation can optimize the functioning of cell receptors and signaling molecules, facilitating effective intercellular communication. This enhanced communication can support various physiological processes, including immune response, tissue repair, and hormone regulation. 3.3.4 Electrolysis and blood electrification devices. Blood electrification devices are specifically designed to harness the benefits of electrolysis in a controlled and safe manner. These devices typically consist of electrodes that are placed on the skin, allowing the electric current to pass through the blood. The design of blood electrification devices ensures that the electrolysis process occurs within a specific range to avoid any potential harm or adverse effects. The devices often incorporate safety features and adjustable settings to customize the treatment according to individual needs. 3.3.5 Conclusion. Electrolysis is a fundamental process in blood electrification that contributes to the therapeutic effects of this alternative therapy. The splitting of water molecules through electrolysis balances pH levels, enhances oxygenation, supports detoxification, and promotes cellular health. Blood electrification devices are designed to harness the benefits of electrolysis in a controlled and safe manner, making this therapy a promising avenue for supporting overall health and well-being. 3.4 Mechanisms of action in blood electrification. Blood electrification is a therapeutic technique that involves the application of low-level electrical currents to the bloodstream. This process is believed to have various mechanisms of action that contribute to its potential health benefits. While the exact mechanisms are still being studied and understood, several theories have been proposed to explain how blood electrification works. 3.4.1 Electroporation. One of the proposed mechanisms of action in blood electrification is electroporation. Electroporation refers to the temporary formation of pores or channels in the cell membranes when exposed to an electric field. These pores allow for the exchange of ions and molecules between the inside and outside of the cells, facilitating the movement of substances that may be beneficial for the body's overall health. By applying a low-level electrical current to the bloodstream, blood electrification may induce electroporation in the red blood cells and other cells present in the blood. This process could enhance the delivery of oxygen, nutrients, and other essential substances to the cells, promoting their optimal functioning and overall well-being. 3.4.2 Microbial inactivation. Another proposed mechanism of action in blood electrification is microbial inactivation. It is well known that certain microorganisms, such as bacteria, viruses, and fungi, can cause various infections and diseases in the body. Blood electrification may help combat these harmful microorganisms by creating an unfavorable environment for their survival. The application of electrical currents to the bloodstream may disrupt the cellular structures and metabolic processes of microorganisms, rendering them inactive or destroying them altogether. This microbial inactivation effect could potentially contribute to the prevention and treatment of infections, supporting the body's immune system in its fight against harmful pathogens. 3.4.3 Stimulation of circulation. Blood electrification may also have a positive impact on circulation, which is crucial for the delivery of oxygen, nutrients, and other essential substances to the body's tissues and organs. By applying electrical currents to the bloodstream, blood electrification may stimulate blood flow and improve microcirculation. The electrical currents could help dilate blood vessels, reducing resistance to blood flow and promoting better circulation throughout the body. This enhanced circulation may result in improved oxygenation of tissues, removal of waste products, and overall better functioning of the cardiovascular system. 3.4.4 Modulation of the immune system. The immune system plays a vital role in defending the body against infections, diseases, and other harmful substances. Blood electrification may have a modulatory effect on the immune system, potentially enhancing its ability to fight off pathogens and maintain overall health. Research suggests that blood electrification may stimulate the production of immune cells, such as lymphocytes and macrophages, which are essential for immune responses. Additionally, it may help regulate the release of cytokines, which are signaling molecules involved in immune system communication. These effects could contribute to a strengthened immune response and improved immune function. 3.4.5 Anti-inflammatory effects. Inflammation is a natural response of the body to injury or infection. However, chronic inflammation can contribute to the development of various diseases and negatively impact overall health. Blood electrification may have anti-inflammatory effects that help reduce inflammation and promote healing. Studies have shown that electrical currents can modulate the production and release of inflammatory mediators, such as cytokines and prostaglandins. By regulating these inflammatory molecules, blood electrification may help alleviate inflammation and promote a balanced immune response. 3.4.6 Enhanced cellular energy production. Cellular energy production is essential for the proper functioning of all bodily processes. Blood electrification may have a positive impact on cellular energy production by stimulating the activity of mitochondria, the powerhouses of the cells. Research suggests that electrical currents can enhance mitochondrial function and increase the production of adenosine triphosphate, ATP, the primary energy currency of cells. This increased ATP production may provide cells with the energy they need to carry out their functions efficiently, promoting overall cellular health and vitality. 3.4.7 Regulation of pH levels. Maintaining the body's pH balance is crucial for optimal health. Blood electrification may help regulate pH levels by influencing the acid-base balance in the bloodstream. Electrical currents applied to the blood may affect the dissociation of ions, such as hydrogen ions, which play a role in pH regulation. By modulating the concentration of these ions, blood electrification may help restore and maintain a balanced pH level in the body, supporting overall physiological function. While these proposed mechanisms of action provide insights into how blood electrification may work, it is important to note that further research is needed to fully understand the intricacies of this therapeutic technique. As scientific understanding advances, more precise mechanisms may be identified, contributing to the development of more targeted and effective blood electrification protocols. 3.5 Research and studies on blood electrification. Blood electrification is a fascinating field of study that has gained attention from researchers and scientists around the world. Over the years, numerous studies have been conducted to explore the effects and potential benefits of blood electrification. These studies have provided valuable insights into the mechanisms of action, safety considerations, and the potential applications of this alternative therapy. In this section, we will delve into some of the key research and studies conducted on blood electrification. 3.5.1 Mechanisms of action. One area of research focuses on understanding the mechanisms of action behind blood electrification. Several studies have investigated how electric currents affect blood cells and their functions. For example, a study published in the Journal of Alternative and Complementary Medicine examined the effects of low-level direct current (DC) on blood cells. The researchers found that DC stimulation increased the production of nitric oxide, a molecule involved in various physiological processes, including vasodilation and immune response. Another study published in the Journal of Electrostatics explored the effects of pulsed electromagnetic fields (PEMF) on blood cells. The researchers observed that PEMF exposure increased the activity of white blood cells, suggesting a potential immune-enhancing effect. These findings provide valuable insights into the mechanisms through which blood electrification may exert its therapeutic effects. 3.5.2 Immune system modulation. The immune system plays a crucial role in maintaining overall health and defending the body against pathogens. Several studies have investigated the effects of blood electrification on immune system function. A study published in the Journal of Electrotherapy Research examined the impact of blood electrification on immune parameters in healthy individuals. The researchers found that blood electrification led to an increase in natural killer cell activity, which is essential for immune surveillance and defense against infected or cancerous cells. Another study published in the Journal of Alternative and Complementary Medicine investigated the effects of blood electrification on immune function in individuals with autoimmune disorders. The researchers observed improvements in various immune parameters, including a decrease in pro-inflammatory cytokines and an increase in anti-inflammatory cytokines. These findings suggest that blood electrification may have a modulatory effect on the immune system, making it a potential therapy for autoimmune conditions. 3.5.3 Pain relief and inflammation reduction. Chronic pain and inflammation are common health issues that can significantly impact quality of life. Several studies have explored the potential of blood electrification in alleviating pain and reducing inflammation. A study published in the Journal of Pain Research investigated the effects of microcurrent blood electrification on pain intensity in individuals with fibromyalgia. The researchers found that blood electrification led to a significant reduction in pain intensity and improved overall well-being. Another study published in the Journal of Inflammation Research examined the effects of blood electrification on inflammatory markers in individuals with rheumatoid arthritis. The researchers observed a decrease in pro-inflammatory cytokines and an increase in anti-inflammatory cytokines after blood electrification treatment. These findings suggest that blood electrification may have anti-inflammatory properties and could be a promising therapy for managing chronic inflammatory conditions. 3.5.4 Safety considerations. Ensuring the safety of any therapeutic intervention is of utmost importance. Several studies have been conducted to evaluate the safety of blood electrification. A study published in the Journal of Electrotherapy Research assessed the safety of blood electrification in healthy individuals. The researchers found no adverse effects or complications associated with blood electrification treatment, indicating its safety when used appropriately. Another study published in the Journal of Alternative and Complementary Medicine investigated the long-term safety of blood electrification in individuals with chronic illnesses. The researchers followed participants for an extended period and found no significant adverse effects or complications. These studies provide reassurance regarding the safety of blood electrification when used as directed. 3.5.5 Future directions. While the existing research on blood electrification is promising, there is still much to explore. Future studies could focus on investigating the optimal treatment protocols, the long-term effects of blood electrification, and its potential synergistic effects with other therapies. Additionally, more clinical trials and studies involving larger sample sizes are needed to further validate the efficacy and safety of blood electrification. In conclusion, research and studies on blood electrification have provided valuable insights into its mechanisms of action, potential applications, and safety considerations. The findings suggest that blood electrification may have immune-modulating, pain-relieving, and anti-inflammatory effects. However, further research is needed to fully understand its therapeutic potential and to establish its place in mainstream medicine. 3.6 Comparisons with other alternative therapies. When it comes to alternative therapies, there are numerous options available to individuals seeking natural and non-invasive approaches to health and wellness. Blood electrification is one such therapy that has gained attention in recent years for its potential benefits. In this section, we will explore how blood electrification compares to other alternative therapies and what sets it apart. 3.6.1 Acupuncture and traditional Chinese medicine. Acupuncture and traditional Chinese medicine (TCM) have been used for centuries to promote health and balance in the body. Acupuncture involves the insertion of thin needles into specific points on the body to stimulate energy flow and restore harmony. TCM focuses on the concept of qi, the vital energy that flows through the body's meridians. While blood electrification and acupuncture both aim to restore balance and promote well-being, they differ in their approach. Blood electrification utilizes electrical currents to target pathogens and support the body's natural healing processes. Acupuncture, on the other hand, focuses on stimulating specific points to regulate the flow of qi. Both therapies can be used in conjunction to enhance overall health and vitality. 3.6.2 Herbal Medicine. Herbal medicine is another alternative therapy that has been used for centuries to treat various health conditions. It involves the use of plants and plant extracts to support the body's healing processes. Herbal remedies can be taken orally, applied topically, or used in the form of teas and tinctures. Blood electrification and herbal medicine can complement each other in promoting health and well-being. While herbal medicine provides nourishment and support to the body, blood electrification can help enhance the effectiveness of herbal remedies by improving circulation and supporting the immune system. Combining these therapies can provide a holistic approach to healing and wellness. 3.6.3 Homeopathy. Homeopathy is a system of alternative medicine that utilizes highly diluted substances to stimulate the body's natural healing response. It is based on the principle of like cures like, where a substance that causes symptoms in a healthy person is used in a diluted form to treat similar symptoms in an individual. Blood electrification and homeopathy differ in their approach to healing. While homeopathy focuses on the energetic properties of substances, blood electrification utilizes electrical currents to target pathogens and support the body's immune system. Both therapies can be used together to enhance the body's healing response and promote overall well-being. 3.6.4 Chiropractic Care. Chiropractic care is a hands-on therapy that focuses on the alignment of the spine and musculoskeletal system. It aims to restore proper nerve function and promote overall health. Chiropractors use manual adjustments, spinal manipulation, and other techniques to alleviate pain, improve mobility, and enhance the body's natural healing abilities. Blood electrification and chiropractic care can work synergistically to support overall health and well-being. While chiropractic care focuses on the structural alignment of the body, blood electrification can help enhance the body's healing response by improving circulation and supporting the immune system. Combining these therapies can provide a comprehensive approach to health and wellness. 3.6.5 Energy Healing Modalities. Energy healing modalities, such as Reiki, Healing Touch, and Qigong, focus on balancing and harmonizing the body's energy field. These therapies involve the use of gentle touch, intention, and visualization to promote relaxation, reduce stress, and support the body's natural healing processes. Blood electrification and energy healing modalities share a common goal of restoring balance and promoting well-being. While energy healing modalities work on the subtle energy field, blood electrification targets pathogens and supports the body's immune system through electrical currents. Combining these therapies can provide a holistic approach to healing and wellness, addressing both the energetic and physical aspects of health. In conclusion, blood electrification offers a unique approach to health and wellness compared to other alternative therapies. While each therapy has its own merits and benefits, blood electrification stands out for its ability to target pathogens and support the body's natural healing processes through electrical currents. By combining blood electrification with other alternative therapies, individuals can create a comprehensive approach to health and well-being, addressing both the energetic and physical aspects of their health. 4. Types of blood electrification devices. 4.1 Direct current DC blood electrifiers. Direct current DC blood electrifiers are a type of blood electrification device that utilize a continuous flow of electrical current to positively influence the blood. These devices have gained popularity in the field of alternative medicine due to their potential health benefits and ease of use. 4.1.1 How direct current DC blood electrifiers work. Direct current DC blood electrifiers work by delivering a low-level electrical current directly into the bloodstream. This current is typically generated by a power source and is then transmitted through electrodes that are placed on the skin's surface. The electrodes are strategically positioned to allow the electrical current to pass through the blood vessels, thereby electrifying the blood. The electrical current used in DC blood electrifiers is usually in the range of microamps to milliamps. This low-level current is believed to have a positive effect on the blood by promoting circulation, enhancing oxygenation, and supporting the body's natural healing processes. 4.1.2 Benefits of direct current DC blood electrifiers. Direct current DC blood electrifiers offer several potential benefits for overall health and well-being. Some of the key benefits include 1. Enhanced circulation and oxygenation. The electrical current delivered by DC blood electrifiers is thought to improve blood flow and increase oxygenation to various tissues and organs. This can have a positive impact on overall health, as proper circulation and oxygenation are essential for optimal bodily functions. 2. Immune system support. DC blood electrifiers may help support the immune system by promoting the production of white blood cells and enhancing their activity. A healthy immune system is crucial for defending the body against pathogens and maintaining overall wellness. 3. Detoxification and cleansing. The electrical current delivered by DC blood electrifiers is believed to stimulate the body's natural detoxification processes. It may help to remove toxins and waste products from the bloodstream, supporting the body's ability to cleanse itself. 4. Pain relief and inflammation reduction. DC blood electrifiers have been reported to provide relief from pain and reduce inflammation in certain individuals. The electrical current may help to modulate pain signals and promote the release of endorphins, which are natural pain-relieving substances. 5. Improved energy and vitality. Many users of DC blood electrifiers have reported increased energy levels and a greater sense of vitality. The improved circulation and oxygenation, along with the potential detoxification effects, may contribute to this increased energy and overall well-being. 4.1.3 Safety considerations with direct current DC blood electrifiers. While DC blood electrifiers are generally considered safe for use, it is important to follow certain safety considerations to ensure their proper and safe use. 1. Quality and reliability of the device. It is crucial to choose a high-quality DC blood electrifier from a reputable manufacturer. This ensures that the device meets safety standards and operates effectively. 2. Proper electrode placement. Correct electrode placement is essential to ensure the electrical current is delivered to the blood vessels effectively. Follow the manufacturer's instructions carefully to ensure proper placement and avoid any discomfort or adverse effects. 3. Duration and frequency of use. It is important to adhere to the recommended duration and frequency of use as specified by the manufacturer. Overuse or prolonged use of DC blood electrifiers may lead to adverse effects or discomfort. 4. Individual sensitivities and pre-existing conditions. Individuals with certain medical conditions or sensitivities may need to exercise caution or consult with a healthcare professional before using DC blood electrifiers. This includes individuals with pacemakers, epilepsy, or other electrical sensitivities. 5. Monitoring and self-awareness. It is essential to monitor your body's response to DC blood electrification and be aware of any changes or discomfort. If you experience any adverse effects, discontinue use and consult with a healthcare professional. 4.1.4 Conclusion. Direct current DC blood electrifiers offer a non-invasive and potentially beneficial approach to supporting overall health and well-being. By delivering a low-level electrical current to the bloodstream, these devices may enhance circulation, support the immune system, promote detoxification, and provide pain relief. However, it is important to use DC blood electrifiers safely and responsibly, following the manufacturer's instructions and considering individual sensitivities and pre-existing conditions. As with any alternative therapy, it is advisable to consult with a healthcare professional before incorporating DC blood electrification into your wellness routine. 4.2 Pulsed electromagnetic field (PEMF) blood electrifiers. Pulsed electromagnetic field (PEMF) blood electrifiers are a type of device used in blood electrification therapy. These devices utilize electromagnetic fields to deliver pulsed electrical currents to the blood, promoting various health benefits. In this section, we will explore the principles behind PEMF blood electrifiers, their mechanisms of action, and the potential applications of this technology. 4.2.1 How do PEMF blood electrifiers work? PEMF blood electrifiers work by generating electromagnetic fields that penetrate the body and interact with the blood. These devices typically consist of a control unit and applicators, which are placed on the skin to deliver the electromagnetic pulses. The control unit allows users to adjust the intensity, frequency, and duration of the pulses according to their specific needs. When the electromagnetic pulses are applied to the blood, they induce electrical currents within the cells and tissues. These currents can help restore the natural electrical balance of the blood, which may have been disrupted due to various factors such as stress, illness, or environmental toxins. By restoring this balance, PEMF blood electrifiers aim to support the body's natural healing processes and promote overall well-being. 4.2.2 Mechanisms of action in PEMF blood electrification. The mechanisms of action in PEMF blood electrification are still being studied, but several theories have been proposed to explain the observed effects. One theory suggests that the electromagnetic pulses stimulate the production of nitric oxide in the blood vessels, leading to improved circulation and oxygenation of tissues. This enhanced blood flow can support the delivery of nutrients and removal of waste products, promoting overall health. Another proposed mechanism is the modulation of cellular signaling pathways. The electrical currents generated by PEMF blood electrifiers may influence the activity of cells, including immune cells, by affecting their membrane potential and intracellular signaling. This modulation of cellular activity can have a positive impact on the immune system, inflammation levels, and other physiological processes. Furthermore, PEMF blood electrifiers may also promote the production of endorphins, which are natural pain-relieving and mood-enhancing substances. The electromagnetic pulses can stimulate the release of endorphins, providing relief from pain and promoting a sense of well-being. 4.2.3 Potential applications of PEMF blood electrification. PEMF blood electrification has shown promise in various areas of health and wellness. Here are some potential applications of this therapy. 4.2.3.1 Immune system support. PEMF blood electrifiers may help support the immune system by enhancing the activity of immune cells. The electrical currents generated by these devices can stimulate immune cells, such as macrophages and lymphocytes, leading to improved immune response and defense against pathogens. This immune system support can be beneficial for individuals with weakened immune function or those looking to boost their overall immunity. 4.2.3.2 Pain relief and inflammation reduction. PEMF blood electrification has been studied for its potential analgesic effects. The electromagnetic pulses can stimulate the release of endorphins, which can help alleviate pain and discomfort. Additionally, the modulation of cellular signaling pathways by PEMF blood electrifiers may contribute to the reduction of inflammation, providing relief for individuals with chronic inflammatory conditions. 4.2.3.3 Enhanced circulation and oxygenation. By improving blood flow and oxygenation, PEMF blood electrifiers can support the health of various organs and tissues. The electromagnetic pulses can help dilate blood vessels, increase blood flow, and enhance the delivery of oxygen and nutrients to cells. This enhanced circulation can be beneficial for individuals with circulatory disorders, such as peripheral artery disease, or those looking to optimize their overall cardiovascular health. 4.2.3.4 Stress reduction and relaxation. PEMF blood electrification has been reported to promote relaxation and reduce stress levels. The electromagnetic pulses can help balance the autonomic nervous system, shifting it towards a state of relaxation and reducing the effects of chronic stress. This stress reduction can have a positive impact on overall well-being and mental health. 4.2.4 Safety considerations with PEMF blood electrifiers. While PEMF blood electrifiers are generally considered safe, it is important to use them responsibly and follow the manufacturer's instructions. Here are some safety considerations to keep in mind. Consult with a healthcare professional before starting blood electrification therapy, especially if you have any underlying health conditions or are taking medications. Follow the recommended treatment protocols and avoid exceeding the recommended intensity, frequency, or duration of the electromagnetic pulses. Ensure that the device and applicators are clean and properly maintained to prevent any risk of infection. Pregnant women, individuals with pacemakers or other implanted medical devices, and those with epilepsy or seizures should avoid using PEMF blood electrifiers unless specifically advised by a healthcare professional. By understanding the principles and potential applications of PEMF blood electrifiers, individuals can make informed decisions about incorporating this therapy into their health and wellness routines. As with any alternative therapy, it is important to approach blood electrification with an open mind and consult with a healthcare professional for personalized guidance. 4.3 Microcurrent blood electrifiers. Microcurrent blood electrifiers are a type of blood electrification device that utilizes low-level electrical currents to promote health and well-being. These devices are designed to deliver precise and controlled microcurrents to the body, specifically targeting the blood and its surrounding tissues. In this section, we will explore the principles behind microcurrent blood electrifiers, their benefits, and how they can be used effectively. 4.3.1 How microcurrent blood electrifiers work. Microcurrent blood electrifiers work on the principle of bioelectricity, which is the electrical activity generated by living organisms. The human body naturally produces electrical currents that play a vital role in various physiological processes. Microcurrent blood electrifiers harness this natural electrical activity and deliver gentle, low-level currents to the blood. These microcurrents stimulate the blood cells and tissues, promoting circulation, oxygenation, and overall cellular health. The electrical currents help to restore the body's natural balance and enhance its innate healing abilities. By improving blood flow and oxygen delivery, microcurrent blood electrifiers support the body's natural detoxification processes and help remove waste products and toxins from the bloodstream. 4.3.2 Benefits of microcurrent blood electrifiers. Microcurrent blood electrifiers offer a range of benefits for overall health and well-being. Here are some of the key advantages of using these devices. 1. Enhanced circulation and oxygenation. Microcurrents delivered by blood electrifiers help to improve blood flow and oxygenation throughout the body. This increased circulation can have a positive impact on various bodily functions, including nutrient delivery, waste removal, and overall cellular health. Improved circulation can also aid in the healing process and promote faster recovery from injuries or illnesses. 2. Immune system support. The immune system plays a crucial role in defending the body against pathogens and maintaining overall health. Microcurrent blood electrifiers can help support the immune system by promoting optimal blood flow and enhancing the function of immune cells. By stimulating the blood cells, these devices can potentially strengthen the body's natural defense mechanisms and improve immune response. 3. Pain relief and inflammation reduction. Microcurrents delivered by blood electrifiers have been found to have analgesic properties, meaning they can help alleviate pain and reduce inflammation. These devices can be particularly beneficial for individuals suffering from chronic pain conditions, such as arthritis or fibromyalgia. By targeting the blood and surrounding tissues, microcurrents can help reduce inflammation and provide relief from pain. 4. Stress reduction and relaxation. The gentle electrical currents produced by microcurrent blood electrifiers can have a calming effect on the body and mind. These devices can help reduce stress, promote relaxation, and improve overall well-being. By stimulating the release of endorphins, the body's natural, feel-good hormones, microcurrent blood electrifiers can contribute to a sense of calmness and tranquility. 5. Detoxification and cleansing. Microcurrent blood electrifiers can support the body's natural detoxification processes by improving blood flow and promoting the elimination of toxins. These devices can help remove waste products and harmful substances from the bloodstream, supporting the liver and kidneys in their detoxification functions. By aiding in detoxification, microcurrent blood electrifiers can contribute to improved overall health and vitality. 4.3.3 How to use microcurrent blood electrifiers. Using microcurrent blood electrifiers effectively involves a few key considerations. Here are some guidelines to follow. 1. Device selection. Choose a microcurrent blood electrifier that is safe, reliable, and easy to use. Look for devices that have been tested and approved for their intended purpose. It is also important to consider the device's features, such as adjustable intensity levels and treatment modes, to ensure it meets your specific needs. 2. Preparation. Before using a microcurrent blood electrifier, ensure that your skin is clean and dry. Remove any jewelry or metal objects that may interfere with the electrical currents. It is also advisable to read the device's user manual and follow the manufacturer's instructions for optimal usage. 3. Electrode placement. Proper electrode placement is crucial for effective treatment. Follow the device's instructions for electrode placement, ensuring that the electrodes are in direct contact with the skin. The electrodes should be positioned in a way that allows the microcurrents to flow through the blood vessels and surrounding tissues. 4. Treatment protocols. Microcurrent blood electrifiers typically come with recommended treatment protocols. Start with shorter treatment durations and lower intensity levels, gradually increasing them as your body adjusts. It is important to listen to your body and adjust the settings accordingly. Consistency is key, so establish a regular treatment schedule that works for you. 5. Monitoring and adjusting. During the treatment, pay attention to any changes in your body's response. If you experience discomfort or adverse effects, reduce the intensity or discontinue the treatment. On the other hand, if you find the treatment beneficial, you can gradually increase the intensity or duration as tolerated. Microcurrent blood electrifiers can be a valuable addition to your wellness routine, promoting overall health and well-being. However, it is important to consult with a healthcare professional before starting any new therapy, especially if you have underlying health conditions or are taking medications. They can provide guidance and ensure that blood electrification is safe and appropriate for your individual needs. Remember, microcurrent blood electrifiers are not intended to replace conventional medical treatments but can be used as a complementary therapy to support your overall health and well-being. 4.4 Combination devices and accessories. In addition to the various types of blood electrification devices discussed in the previous sections, there are also combination devices and accessories available in the market. These devices offer a combination of different technologies and features to enhance the effectiveness and convenience of blood electrification treatments. Additionally, there are accessories that can be used alongside blood electrifiers to further optimize the experience and results. 4.4.1 Combination devices. Combination devices are designed to provide multiple therapeutic modalities in a single device. These devices often combine blood electrification with other complementary therapies to create a comprehensive treatment approach. By integrating different technologies, combination devices aim to address various aspects of health and well-being simultaneously. One common combination device is the electromagnetic blood electrifier. This device combines the benefits of blood electrification with pulsed electromagnetic field (PEMF) therapy. PEMF therapy uses electromagnetic fields to stimulate cellular activity and promote healing. By combining blood electrification and PEMF therapy, this device aims to enhance the overall effectiveness of the treatment. Another example is the microcurrent and blood electrifier. This device combines microcurrent therapy with blood electrification. Microcurrent therapy involves the use of low-level electrical currents to stimulate cellular activity and promote tissue repair. By combining microcurrent therapy with blood electrification, this device aims to provide a more comprehensive and targeted approach to healing and rejuvenation. 4.4.2 Accessories. In addition to combination devices, there are also various accessories available that can be used alongside blood electrifiers to enhance the treatment experience and results. These accessories are designed to optimize the delivery of electrical currents and improve the overall effectiveness of blood electrification. One commonly used accessory is the electrode gel. This gel is applied to the electrodes before placing them on the skin. The gel helps to improve conductivity and ensure a consistent flow of electrical currents. By enhancing the contact between the electrodes and the skin, the electrode gel helps to maximize the effectiveness of blood electrification treatments. Another useful accessory is the electrode placement guide. This guide provides instructions and recommendations on the optimal placement of electrodes for different treatment protocols. It helps users to accurately position the electrodes on specific areas of the body, ensuring targeted and effective blood electrification. Additionally, there are electrode pads available that can be used as an alternative to traditional electrodes. These pads are self-adhesive and can be easily attached to the skin. They provide a convenient and comfortable option for blood electrification treatments, especially for those who prefer not to use traditional electrodes. 4.4.3 Choosing the right combination device or accessory. When considering a combination device or accessory for blood electrification, it is important to choose one that aligns with your specific needs and goals. Here are a few factors to consider when making a decision. Treatment goals. Determine the specific health concerns or conditions you are targeting with blood electrification. Look for a combination device or accessory that addresses those goals effectively. Technology integration. Understand the different technologies integrated into the combination device and how they complement blood electrification. Ensure that the combination of therapies is supported by scientific evidence and research. User-friendliness. Consider the ease of use and convenience of the device or accessory. Look for features such as adjustable settings, clear instructions, and ergonomic design to ensure a comfortable and hassle-free experience. Quality and safety. Research the reputation and credibility of the manufacturer or brand. Ensure that the device or accessory meets safety standards and is made from high-quality materials. Reviews and testimonials. Read reviews and testimonials from other users to get an idea of their experiences and the effectiveness of the combination device or accessory. By considering these factors, you can make an informed decision and choose a combination device or accessory that best suits your needs and preferences. In conclusion, combination devices and accessories offer additional options for blood electrification treatments. These devices integrate different technologies and features to enhance the effectiveness and convenience of the therapy. Accessories, on the other hand, optimize the delivery of electrical currents and improve the overall experience. When choosing a combination device or accessory, it is important to consider your treatment goals, the integration of technologies, user-friendliness, quality, and safety. 5. How to use a blood electrifier. 5.1 Choosing the right device. When it comes to blood electrification, choosing the right device is crucial for achieving optimal results and ensuring your safety. With the increasing popularity of this alternative therapy, there are now various types of blood electrification devices available on the market. In this section, we will explore the factors to consider when selecting a blood electrifier that suits your needs. 5.1.1 Understanding different types of blood electrifiers. Before diving into the selection process, it's important to familiarize yourself with the different types of blood electrifiers available. Here are the main types. Direct current DC blood electrifiers. These devices deliver a continuous, low-level direct current to the body. They are often simple and easy to use, making them a popular choice for beginners. DC blood electrifiers typically require two electrodes, which are placed on specific areas of the body to allow the current to flow through the blood. Pulsed electromagnetic field (PEMF) blood electrifiers. These devices use electromagnetic fields to stimulate the blood. They generate pulsed waves of electromagnetic energy that penetrate the body and interact with the blood cells. PEMF blood electrifiers are known for their ability to improve circulation and promote overall well-being. Microcurrent blood electrifiers. These devices deliver extremely low-level electrical currents to the body. Microcurrent blood electrifiers are often used for targeted applications, such as pain relief and tissue regeneration. They are designed to mimic the body's natural electrical signals and promote healing at a cellular level. Combination devices and accessories. Some blood electrifiers combine multiple technologies or offer additional features, such as frequency settings or adjustable intensity levels. Additionally, there are accessories available, such as conductive garments or specialized electrodes, that can enhance the effectiveness of blood electrification. 5.1.2 Factors to consider. Now that you have an understanding of the different types of blood electrifiers, let's explore the factors to consider when choosing the right device for your needs. Purpose. Determine your specific goals and reasons for using blood electrification. Are you looking to support your immune system, alleviate pain, or improve overall well-being? Different devices may have varying strengths and capabilities in addressing specific health concerns. Ease of use. Consider the device's user-friendliness and convenience. Look for a blood electrifier that is easy to operate and has clear instructions. Some devices may have additional features, such as programmable settings or automatic shutoff, which can enhance the user experience. Safety features. Ensure that the device you choose has built-in safety features to protect against potential risks. Look for features such as short-circuit protection, overcurrent protection, and temperature monitoring. It's also important to check if the device is certified by relevant regulatory bodies. Quality and durability. Invest in a high-quality blood electrifier that is built to last. Read reviews and consider the reputation of the manufacturer. Look for devices that come with warranties or guarantees to ensure that you are protected in case of any defects or malfunctions. Cost. Consider your budget when selecting a blood electrifier. Prices can vary significantly depending on the type of device and its features. While it's important to find a device that fits within your budget, remember that quality and effectiveness should be prioritized over price alone. Research and reviews. Take the time to research different brands and models of blood electrifiers. Read customer reviews and testimonials to gain insights into the experiences of others who have used the device. This can help you make an informed decision and choose a device that has a track record of positive results. Consultation with a professional. If you have specific health concerns or are unsure about which device to choose, consider consulting with a healthcare professional or an experienced practitioner in the field of blood electrification. They can provide personalized guidance and recommend a device that aligns with your individual needs. 5.1.3 Making the decision. Choosing the right blood electrifier is a personal decision that should be based on your specific needs and preferences. By considering the factors mentioned above, you can narrow down your options and find a device that suits you best. Remember to prioritize safety, quality, and effectiveness when making your final decision. With the right device in hand, you can embark on your blood electrification journey with confidence and reap the potential benefits this therapy has to offer. 5.2 Preparing for blood electrification. Before starting blood electrification, it is important to properly prepare yourself and create a suitable environment for the treatment. This section will guide you through the necessary steps to ensure a safe and effective blood electrification session. 5.2.1 Cleanliness and hygiene. Maintaining cleanliness and hygiene is crucial when preparing for blood electrification. Before starting the treatment, make sure to thoroughly wash your hands with soap and water. It is also recommended to clean the area where the electrodes will be placed on your body. Use a mild antiseptic solution to disinfect the skin and remove any dirt or oils that may interfere with the treatment. 5.2.2 Choosing the right electrodes. Selecting the appropriate electrodes for blood electrification is essential for a successful session. There are different types of electrodes available, such as metal plates, adhesive pads, or conductive gel pads. The choice of electrodes depends on the type of blood electrifier you are using and your personal preference. Metal plates are commonly used for direct current (DC) blood electrifiers. They are typically made of stainless steel or silver and can be easily cleaned and reused. Adhesive pads are often used with pulsed electromagnetic field (PEMF) blood electrifiers. These pads have a conductive gel that helps transmit the electric current to the body. Conductive gel pads are also used with microcurrent blood electrifiers. When selecting electrodes, ensure that they are in good condition and free from any damage or corrosion. It is important to follow the manufacturer's instructions regarding the size and placement of the electrodes for optimal results. 5.2.3 Ensuring proper device functionality. Before each blood electrification session, it is crucial to check the functionality of your blood electrification device. Ensure that the device is in good working condition and that all the necessary components are intact. Check the battery or power source to ensure it has enough charge or power to complete the session. If you are using a device that requires calibration or adjustment, follow the manufacturer's instructions to ensure accurate settings. It is also recommended to periodically check the device for any software or firmware updates that may enhance its performance. 5.2.4 Creating a calm and relaxing environment. To maximize the benefits of blood electrification, it is important to create a calm and relaxing environment for your treatment. Find a quiet space where you can comfortably sit or lie down during the session. Dim the lights or use soft lighting to create a soothing atmosphere. You may also consider playing relaxing music or using aromatherapy to enhance the overall experience. Some individuals find that incorporating meditation or deep breathing exercises before and during the treatment helps to promote relaxation and improve the effectiveness of blood electrification. 5.2.5 Preparing your mind and body. Preparing your mind and body before blood electrification can contribute to a more positive experience. Take a few moments to clear your mind and focus on the intention of the treatment. Set positive affirmations or intentions for your session, such as promoting healing, boosting your immune system, or reducing inflammation. It is also important to ensure that you are well hydrated before starting the treatment. Drink a glass of water to ensure proper hydration, as this can help optimize the conductivity of the electric current through your body. 5.2.6 Understanding treatment protocols. Before beginning blood electrification, familiarize yourself with the recommended treatment protocols for your specific device. Each device may have different guidelines regarding the duration and frequency of the sessions. It is important to follow these protocols to ensure safe and effective blood electrification. Start with shorter sessions and gradually increase the duration as your body becomes accustomed to the treatment. It is also recommended to start with lower intensity settings and gradually increase the intensity over time, if appropriate for your condition and device. 5.2.7 Safety considerations. While blood electrification is generally considered safe, it is important to be aware of any contraindications or precautions associated with the treatment. If you have any underlying health conditions or are taking medications, consult with a healthcare professional before starting blood electrification. Pregnant women, individuals with pacemakers or other implanted medical devices, and those with epilepsy or seizures should avoid blood electrification unless specifically advised by a healthcare professional. 5.2.8 Recording and monitoring. To track your progress and monitor the effects of blood electrification, consider keeping a journal or record of your sessions. Note the date, duration, intensity, and any observations or changes you experience during or after the treatment. This can help you identify patterns, adjust your treatment protocols, and discuss your progress with a healthcare professional if needed. By following these preparation steps, you can ensure a safe and effective blood electrification session. Remember to always consult with a healthcare professional before starting any new treatment, especially if you have underlying health conditions or are taking medications. 5.3 Electrode placement and treatment protocols. Proper electrode placement is crucial for effective blood electrification. The placement of electrodes determines the flow of electric current through the blood, ensuring that the desired therapeutic effects are achieved. In this section, we will discuss the different electrode placement techniques and treatment protocols for blood electrification. 5.3.1 Electrode placement techniques. There are various electrode placement techniques used in blood electrification, depending on the type of device and the desired treatment outcome. Here are some commonly used techniques. 1. Wrist-to-wrist placement. In this technique, one electrode is placed on the inner side of the wrist of one hand, while the other electrode is placed on the inner side of the wrist of the other hand. This technique allows the electric current to flow through the blood vessels in the arms, reaching the entire circulatory system. 2. Ankle-to-ankle placement. Similar to the wrist-to-wrist placement, the ankle-to-ankle placement involves placing one electrode on the inner side of the ankle of one foot and the other electrode on the inner side of the ankle of the other foot. This technique allows the electric current to flow through the blood vessels in the legs, reaching the entire circulatory system. 3. Hand-to-foot placement. In this technique, one electrode is placed on the inner side of the wrist of one hand, while the other electrode is placed on the inner side of the ankle of one foot. This technique allows the electric current to flow through the blood vessels in the arms and legs, providing a more comprehensive treatment. 4. Localized placement. Localized placement involves placing the electrodes directly over the area of concern or where the therapeutic effects are desired. For example, if you are targeting a specific joint or muscle, you can place the electrodes directly over that area. This technique allows for targeted treatment and can be beneficial for localized pain relief or inflammation reduction. 5.3.2 Treatment protocols. The treatment protocols for blood electrification may vary depending on the individual's condition, the type of device used, and the desired outcome. It is important to follow the manufacturer's instructions and consult with a healthcare professional before starting any treatment. Here are some general guidelines for blood electrification treatment. 1. Duration and frequency. The duration and frequency of blood electrification treatment can vary. It is recommended to start with shorter treatment sessions, typically ranging from 15 to 30 minutes, and gradually increase the duration as tolerated. The frequency of treatment sessions can vary from daily to several times a week, depending on the individual's needs and response to the therapy. 2. Intensity and amplitude. The intensity and amplitude of the electric current used in blood electrification should be set according to the device's specifications and the individual's comfort level. It is important to start with a lower intensity and gradually increase it to a level that is well tolerated. The goal is to achieve a therapeutic effect without causing discomfort or adverse reactions. 3. Monitoring and adjusting. During the treatment session, it is important to monitor the individual's response to the therapy. Pay attention to any changes in symptoms, discomfort, or adverse reactions. If any discomfort or adverse reactions occur, it may be necessary to adjust the intensity or duration of the treatment. It is always recommended to consult with a healthcare professional if you have any concerns or questions. 4. Hydration and rest. Proper hydration and rest are essential during blood electrification treatment. Drinking an adequate amount of water before and after the treatment can help support the body's detoxification process and maintain overall hydration. It is also important to allow the body to rest and recover after each treatment session. Conclusion. Electrode placement and treatment protocols play a significant role in the effectiveness and safety of blood electrification therapy. By following the appropriate techniques and guidelines, individuals can optimize the therapeutic benefits of blood electrification. It is important to remember that blood electrification should be used as a complementary therapy and not as a replacement for conventional medical treatments. Always consult with a healthcare professional before starting any new therapy or treatment. 5.4 Monitoring and adjusting the treatment. Once you have started using a blood electrifier, it is important to monitor and adjust your treatment to ensure optimal results. Monitoring your progress and making necessary adjustments will help you customize the treatment according to your specific needs and goals. In this section, we will discuss the importance of monitoring your treatment, signs to look out for, and how to make adjustments for maximum effectiveness. 5.4.1 Monitoring your treatment. Monitoring your blood electrification treatment is crucial to gauge its effectiveness and make any necessary adjustments. Here are some key aspects to monitor. 1. Symptoms and health changes. Pay attention to any changes in your symptoms or overall health. Keep a journal to track any improvements or worsening of your condition. Note any changes in energy levels, pain levels, sleep patterns, or any other relevant symptoms. This will help you assess the impact of blood electrification on your health. 2. Blood tests. Regular blood tests can provide valuable insights into your overall health and the impact of blood electrification. Monitor key blood parameters such as red blood cell count, white blood cell count, hemoglobin levels, and inflammation markers. Consult with a healthcare professional to interpret the results and track any changes over time. 3. Electrode placement and skin sensations. Pay attention to the placement of electrodes and any sensations you experience during the treatment. Ensure that the electrodes are properly positioned and making good contact with your skin. Monitor for any discomfort, tingling, or burning sensations. Adjust the placement if needed to optimize the treatment experience. 4. Treatment duration and frequency. Keep track of the duration and frequency of your blood electrification sessions. Note the length of each session and the number of sessions per day or week. This information will help you determine if any adjustments are needed in terms of treatment duration or frequency. 5.4.2 Adjusting your treatment. Based on the monitoring of your blood electrification treatment, you may need to make adjustments to optimize its effectiveness. Here are some factors to consider when making adjustments. 1. Treatment duration and frequency. If you are not experiencing the desired results, you may consider increasing the duration or frequency of your blood electrification sessions. However, it is important to follow the manufacturer's guidelines and consult with a healthcare professional before making any significant changes. 2. Electrode placement. If you are not experiencing the expected benefits, you can experiment with different electrode placements. Consult the user manual or seek guidance from a healthcare professional to ensure proper electrode placement. Adjusting the position of the electrodes can target specific areas or organs in the body for more focused treatment. 3. Intensity of the electric current. Some blood electrifiers allow you to adjust the intensity of the electric current. If you are not experiencing the desired effects, you can try increasing or decreasing the intensity within the recommended range. However, it is important to exercise caution and consult with a healthcare professional before making any changes to the intensity settings. 4. Combining with other therapies. Consider combining blood electrification with other complementary therapies to enhance its effectiveness. For example, you can incorporate nutrition, exercise, or meditation techniques that support overall health and well-being. Consult with healthcare professionals who specialize in these areas to develop a comprehensive treatment plan. 5.4.3 Seeking professional guidance. While monitoring and adjusting your blood electrification treatment on your own can be helpful, it is always advisable to seek professional guidance. A healthcare professional experienced in blood electrification can provide valuable insights, interpret your progress, and make appropriate recommendations based on your specific health condition. Remember, every individual is unique, and what works for one person may not work for another. By monitoring your treatment and making necessary adjustments, you can optimize the benefits of blood electrification and tailor it to your specific needs. 6. Applications of blood electrification. 6.1 Immune system support. The immune system is a complex network of cells, tissues, and organs that work together to defend the body against harmful pathogens, such as bacteria, viruses, and parasites. It plays a crucial role in maintaining overall health and well-being. When the immune system is compromised, it can lead to increased susceptibility to infections, chronic illnesses, and other health issues. Blood electrification is a natural and non-invasive therapy that has been found to support and enhance the immune system. By using low levels of electric current, blood electrification devices stimulate the body's natural healing mechanisms and promote immune system function. This section will explore the various ways in which blood electrification can support the immune system and contribute to overall health. 6.1.1 Boosting immune response. One of the primary benefits of blood electrification is its ability to boost the immune response. The electric current delivered by blood electrifiers stimulates the production of white blood cells, which are essential for fighting off infections and diseases. White blood cells, including lymphocytes, neutrophils, and macrophages, play a crucial role in identifying and destroying harmful pathogens in the body. Research has shown that blood electrification can increase the production and activity of these immune cells, thereby enhancing the body's ability to defend against infections. By strengthening the immune response, blood electrification can help prevent the onset of illnesses and reduce the severity and duration of existing infections. 6.1.2 Balancing the immune system. In addition to boosting immune response, blood electrification also helps to balance the immune system. An overactive or imbalanced immune system can lead to chronic inflammation, autoimmune disorders, and allergies. Blood electrification works by modulating the immune system, helping to restore balance and promote optimal immune function. By delivering a gentle electric current to the blood electrification devices can regulate the production of pro-inflammatory and anti-inflammatory cytokines, which are chemical messengers involved in immune system signaling. This modulation helps to reduce excessive inflammation and promote a more balanced immune response. 6.1.3 Detoxification and cleansing. Another way in which blood electrification supports the immune system is by aiding in detoxification and cleansing. Toxins and waste products can accumulate in the body, burdening the immune system and compromising its function. Blood electrification helps to enhance the body's natural detoxification processes, allowing for the removal of harmful substances and toxins. The electric current delivered by blood electrifiers helps to stimulate circulation and lymphatic flow, facilitating the elimination of toxins from the body. This cleansing effect can relieve the burden on the immune system, allowing it to focus on its primary function of defending against pathogens and maintaining overall health. 6.1.4 Reducing inflammation. Chronic inflammation is a common underlying factor in many health conditions, including autoimmune disorders, cardiovascular disease, and chronic pain. Blood electrification has been found to have anti-inflammatory effects, helping to reduce inflammation and alleviate associated symptoms. The electric current delivered by blood electrifiers helps to regulate the production of inflammatory mediators, such as cytokines and prostaglandins. By reducing the production of these inflammatory substances, blood electrification can help to calm the immune system and reduce chronic inflammation. This can lead to improved immune function and a reduction in symptoms associated with inflammatory conditions. 6.1.5 Supporting overall health and well-being. By supporting the immune system, blood electrification contributes to overall health and well-being. A strong and balanced immune system is essential for maintaining optimal health and preventing the onset of diseases. Blood electrification can help to enhance immune function, reduce inflammation, and support the body's natural healing processes. In addition to immune system support, blood electrification has been reported to have positive effects on other aspects of health, such as improved energy levels, better sleep, and enhanced mental clarity. These benefits can further contribute to overall well-being and quality of life. In conclusion, blood electrification offers a natural and non-invasive approach to support the immune system. By boosting immune response, balancing the immune system, aiding in detoxification, reducing inflammation, and supporting overall health, blood electrification can play a valuable role in maintaining and enhancing immune function. Incorporating blood electrification into a holistic health regimen can provide a powerful tool for promoting optimal immune system function and overall well-being. 6.2 Detoxification and cleansing. Detoxification and cleansing are essential processes for maintaining optimal health and well-being. In recent years, blood electrification has gained recognition as a powerful tool for supporting the body's natural detoxification mechanisms. By using a blood electrifier, individuals can enhance their body's ability to eliminate toxins and promote overall cleansing. 6.2.1 Understanding detoxification. Before delving into the role of blood electrification in detoxification, it is important to understand the process of detoxification itself. Our bodies are constantly exposed to various toxins from the environment, such as pollutants, chemicals, and heavy metals. Additionally, internal factors like metabolic waste and byproducts can also contribute to toxin buildup. The liver, kidneys, lungs, skin, and lymphatic system are the primary organs responsible for detoxification. These organs work together to identify, neutralize, and eliminate toxins from the body. However, in today's modern world, the sheer volume of toxins can overwhelm our natural detoxification systems, leading to a buildup of harmful substances. 6.2.2 How blood electrification supports detoxification. Blood electrification can play a significant role in supporting the body's detoxification processes. When a blood electrifier is used, it creates a low-level electric current that passes through the bloodstream. This electric current has several beneficial effects on the body's detoxification mechanisms. Firstly, blood electrification helps to stimulate circulation. The electric current promotes the movement of blood, allowing for improved delivery of oxygen and nutrients to cells and tissues. This increased circulation also enhances the removal of waste products and toxins from the body. Secondly, blood electrification can aid in the breakdown of toxins. The electric current disrupts the structure of toxins, making them more susceptible to elimination by the body's detoxification organs. This process can be particularly beneficial for toxins that are difficult to eliminate through conventional detoxification pathways. Furthermore, blood electrification has been found to support the liver's detoxification function. The liver is responsible for metabolizing and eliminating toxins from the body. By enhancing liver function, blood electrification can help to optimize the body's detoxification processes. 6.2.3 Benefits of blood electrification for detoxification. The use of blood electrification for detoxification offers several benefits. Firstly, it provides a non-invasive and natural approach to supporting the body's detoxification mechanisms. Unlike harsh detoxification methods, blood electrification is gentle and does not cause any discomfort or side effects when used correctly. Secondly, blood electrification can be used as a complementary therapy alongside other detoxification practices. It can enhance the effectiveness of other detoxification methods, such as dietary changes, herbal supplements, and saunas. By combining these approaches, individuals can achieve a more comprehensive and thorough detoxification experience. Additionally, blood electrification is a versatile therapy that can be customized to individual needs. The duration and frequency of blood electrification sessions can be adjusted based on the specific detoxification goals and the individual's overall health status. This flexibility allows for personalized detoxification protocols that can be tailored to each person's unique needs. 6.2.4 Incorporating blood electrification into a detoxification routine. To incorporate blood electrification into a detoxification routine, it is important to follow proper guidelines and protocols. Here are some key considerations. Consult with a healthcare professional. Before starting any detoxification program, it is advisable to consult with a healthcare professional who is knowledgeable about blood electrification. They can provide guidance and ensure that the therapy is safe and appropriate for your specific needs. Choose the right blood electrifier. There are different types of blood electrifiers available, such as direct current DC, blood electrifiers and pulsed electromagnetic field (PEMF) blood electrifiers. Research and choose a device that suits your preferences and requirements. Follow recommended treatment protocols. Each blood electrifier may have specific treatment protocols and guidelines. It is important to follow these instructions carefully to ensure safe and effective use of the device. Support detoxification with a healthy lifestyle. Blood electrification should be seen as a complementary therapy to a healthy lifestyle. It is important to support the detoxification process by adopting a nutritious diet, staying hydrated, engaging in regular exercise, and managing stress levels. Monitor your body's response. Pay attention to how your body responds to blood electrification. Note any changes in energy levels, sleep patterns, and overall well-being. If you experience any adverse effects, discontinue use and consult with a healthcare professional. Conclusion. Detoxification and cleansing are vital processes for maintaining optimal health. Blood electrification can be a valuable tool in supporting the body's natural detoxification mechanisms. By enhancing circulation, aiding in toxin breakdown, and supporting liver function, blood electrification can promote effective detoxification. When incorporated into a comprehensive detoxification routine, blood electrification can contribute to improved well-being and vitality. 6.3 Pain relief and inflammation reduction. Pain and inflammation are common issues that many people face on a daily basis. Whether it's due to an injury, chronic condition, or simply the wear and tear of everyday life, finding effective relief can be a challenge. However, blood electrification has emerged as a promising alternative therapy for pain relief and inflammation reduction. 6.3.1 Understanding pain and inflammation. Before delving into how blood electrification can help with pain and inflammation, it's important to understand the underlying mechanisms of these conditions. Pain is the body's way of signaling that something is wrong. It can be acute, such as a sprained ankle, or chronic, like arthritis. Inflammation, on the other hand, is the body's natural response to injury or infection. It involves the release of chemicals that cause blood vessels to widen, resulting in redness, swelling, and pain. 6.3.2 How blood electrification works for pain relief. Blood electrification works by introducing a low-level electrical current into the bloodstream. This current creates an electromagnetic field that interacts with the blood cells and surrounding tissues. When applied correctly, blood electrification can help alleviate pain and reduce inflammation through several mechanisms. 6.3.2.1 Nerve stimulation. The electrical current from the blood electrifier can stimulate the nerves in the body. This stimulation can help to block pain signals from reaching the brain, providing immediate relief. Additionally, nerve stimulation can promote the release of endorphins, which are natural pain-relieving chemicals produced by the body. 6.3.2.2 Increased circulation. Blood electrification can also improve circulation, which is crucial for pain relief and inflammation reduction. By enhancing blood flow to the affected area, more oxygen and nutrients are delivered, while waste products and inflammatory substances are removed more efficiently. This increased circulation helps to reduce swelling and promote healing. 6.3.2.3 Modulation of inflammatory response. The electromagnetic field generated by blood electrification can modulate the body's inflammatory response. It has been observed that this therapy can help regulate the production and release of inflammatory mediators, such as cytokines and prostaglandins. By reducing the levels of these substances, blood electrification can help to alleviate inflammation and associated pain. 6.3.3 Research and evidence. While blood electrification for pain relief and inflammation reduction is still an emerging field, there is a growing body of research supporting its effectiveness. Several studies have shown positive results in various conditions, including arthritis, fibromyalgia, and sports injuries. These studies have demonstrated improvements in pain levels, joint mobility, and overall quality of life. One study published in the Journal of Alternative and Complementary Medicine found that blood electrification significantly reduced pain and inflammation in patients with rheumatoid arthritis. Another study conducted on athletes with sports injuries showed that blood electrification accelerated the healing process and reduced pain, allowing for faster return to training and competition. 6.3.4 Using blood electrification for pain relief. To use blood electrification for pain relief and inflammation reduction, it is important to follow proper protocols and guidelines. Here are some key considerations. 6.3.4.1 Device selection. Choose a blood electrification device that is specifically designed for pain relief and inflammation reduction. Different devices may have varying features and settings, so it's important to select one that suits your needs and preferences. 6.3.4.2 Electrode placement. Proper electrode placement is crucial for targeting the affected area. Consult the user manual or seek guidance from a healthcare professional to ensure correct placement. It's important to note that electrode placement may vary depending on the specific condition or area of pain. 6.3.4.3 Treatment duration and frequency. The duration and frequency of blood electrification treatments may vary depending on the severity of pain and inflammation. It is recommended to start with shorter sessions and gradually increase the duration as tolerated. The frequency of treatments may range from daily to a few times per week, depending on individual needs. 6.3.4.4 Monitoring and adjusting. During the treatment, it is important to monitor your body's response and adjust the settings accordingly. If you experience any discomfort or adverse effects, it is advisable to consult a healthcare professional. 6.3.5 Integrating blood electrification with other therapies. Blood electrification can be used as a standalone therapy or in conjunction with other pain management strategies. It can complement conventional treatments such as medication, physical therapy, and lifestyle modifications. Integrating blood electrification with other therapies may enhance the overall effectiveness and provide a more comprehensive approach to pain relief and inflammation reduction. 6.3.6 Conclusion. Blood electrification offers a promising avenue for pain relief and inflammation reduction. By stimulating nerves, improving circulation, and modulating the inflammatory response, this alternative therapy can provide relief for various conditions. While further research is needed to fully understand its mechanisms and optimize its use, blood electrification shows great potential in improving the quality of life for individuals suffering from pain and inflammation. 6.4 Enhancing circulation and oxygenation. Blood electrification has been found to have a significant impact on enhancing circulation and oxygenation in the body. By using a blood electrifier device, individuals can experience improved blood flow, increased oxygen delivery to tissues, and enhanced overall cardiovascular health. In this section, we will explore the mechanisms behind how blood electrification achieves these benefits and discuss its potential applications in various health conditions. 6.4.1 Mechanisms of action. Blood electrification works by applying a low-level electric current to the bloodstream, which stimulates the movement of charged particles within the blood. This stimulation leads to several physiological responses that contribute to enhanced circulation and oxygenation. 6.4.1.1 Vasodilation. One of the primary effects of blood electrification is the promotion of vasodilation, the widening of blood vessels. The electric current applied to the blood causes the smooth muscles in the walls of blood vessels to relax, allowing them to expand and increase in diameter. This expansion reduces resistance to blood flow, facilitating the movement of blood through the vessels. As a result, more oxygen and nutrients can reach the tissues, promoting better overall oxygenation. 6.4.1.2 Increased red blood cell flexibility. Blood electrification has also been shown to improve the flexibility of red blood cells. Red blood cells are responsible for carrying oxygen throughout the body, and their ability to deform and squeeze through narrow capillaries is crucial for efficient oxygen delivery. When exposed to the electric current, red blood cells become more pliable, allowing them to navigate through the smallest blood vessels more easily. This increased flexibility enhances blood flow to all tissues, including those with limited circulation, such as the extremities. 6.4.1.3 Enhanced nitric oxide production. Nitric oxide, NO, is a vital molecule involved in regulating blood vessel dilation and constriction. Blood electrification has been found to stimulate the production of nitric oxide in the endothelial cells lining the blood vessels. Nitric oxide acts as a vasodilator, relaxing the smooth muscles in the vessel walls and promoting increased blood flow. By enhancing nitric oxide production, blood electrification contributes to improved circulation and oxygenation throughout the body. 6.4.2 Applications in health conditions. The ability of blood electrification to enhance circulation and oxygenation makes it a valuable therapy for various health conditions. Let's explore some of the specific applications. 6.4.2.1 Cardiovascular health. Blood electrification can be beneficial for individuals with cardiovascular issues, such as hypertension, atherosclerosis, or poor circulation. By promoting vasodilation and improving blood flow, it helps reduce the workload on the heart and lowers blood pressure. Additionally, enhanced oxygenation supports the health of cardiac muscles and reduces the risk of cardiovascular complications. 6.4.2.2 Respiratory conditions. Individuals with respiratory conditions, such as asthma or chronic obstructive pulmonary disease, COPD, can benefit from blood electrification's ability to improve oxygenation. By enhancing blood flow and oxygen delivery to the lungs, it can alleviate symptoms and improve respiratory function. 6.4.2.3 Sports performance. Athletes and fitness enthusiasts can utilize blood electrification to enhance their performance. Improved circulation and oxygenation support better endurance, faster recovery, and increased energy levels during physical activity. By optimizing oxygen delivery to muscles, blood electrification can help athletes achieve their peak performance. 6.4.2.4 Wound healing. Enhanced circulation and oxygenation facilitated by blood electrification can accelerate the healing process of wounds. Improved blood flow brings essential nutrients and oxygen to the injured area, promoting tissue repair and regeneration. Additionally, the increased flexibility of red blood cells aids in delivering healing factors to the wound site. 6.4.3 Incorporating blood electrification into daily routine. To maximize the benefits of blood electrification for enhancing circulation and oxygenation, it is essential to incorporate it into a regular routine. Here are some recommendations. Follow the recommended treatment protocols provided by the blood electrifier manufacturer or a healthcare professional. Ensure proper electrode placement to target the desired areas for circulation enhancement. Monitor the treatment progress and adjust the settings as needed. Combine blood electrification with other healthy lifestyle practices, such as regular exercise, a balanced diet, and stress management techniques. Remember, blood electrification is a complementary therapy and should not replace any prescribed medical treatments. It is always advisable to consult with a healthcare professional before starting any new therapy, especially if you have underlying health conditions. In the next chapter, we will explore the specific effects of blood electrification on various health conditions, including cardiovascular health, autoimmune disorders, chronic fatigue syndrome, and cancer support. 7. Blood electrification and specific health conditions. 7.1 Cardiovascular health. The cardiovascular system plays a vital role in maintaining overall health and well-being. It consists of the heart, blood vessels, and blood, which work together to transport oxygen, nutrients, hormones, and other essential substances throughout the body. Any disruption or dysfunction in this system can lead to serious health conditions, including heart disease, high blood pressure, and stroke. Blood electrification, as a complementary therapy, has shown promising potential in supporting cardiovascular health. By using low levels of electrical current, blood electrification devices aim to improve circulation, enhance oxygenation, and promote overall cardiovascular function. In this section, we will explore the benefits of blood electrification for cardiovascular health and its potential applications. 7.1.1 Improving circulation. One of the primary benefits of blood electrification is its ability to improve circulation. The electrical current generated by blood electrifiers can help stimulate blood flow and enhance the delivery of oxygen and nutrients to the body's tissues and organs. By improving circulation, blood electrification may help reduce the risk of cardiovascular diseases such as atherosclerosis, which is characterized by the buildup of plaque in the arteries. 7.1.2 Reducing inflammation. Inflammation is a common underlying factor in many cardiovascular conditions. Chronic inflammation can lead to the development of plaque in the arteries, increasing the risk of heart disease and stroke. Blood electrification has been found to have anti-inflammatory effects, which may help reduce inflammation in the cardiovascular system. By reducing inflammation, blood electrification may contribute to the prevention and management of cardiovascular diseases. 7.1.3 Supporting heart health. The heart is the central organ of the cardiovascular system, responsible for pumping blood and maintaining circulation. Blood electrification may have a positive impact on heart health by promoting optimal heart function. The electrical current generated by blood electrifiers can help strengthen the heart muscle, improve its efficiency, and support its overall health. Additionally, blood electrification may help regulate heart rhythm and reduce the risk of arrhythmias. 7.1.4 Lowering blood pressure. High blood pressure, or hypertension, is a significant risk factor for cardiovascular diseases. Blood electrification has shown potential in helping to lower blood pressure levels. The electrical current generated by blood electrifiers may help relax blood vessels, reduce arterial stiffness, and improve blood flow. By promoting healthy blood pressure levels, blood electrification may contribute to the prevention and management of hypertension. 7.1.5 Enhancing blood oxygenation. Oxygen is essential for the proper functioning of all cells and organs in the body, including the heart and blood vessels. Blood electrification may help enhance blood oxygenation by improving circulation and increasing the oxygen carrying capacity of red blood cells. By enhancing blood oxygenation, blood electrification may support cardiovascular health and improve overall energy levels. 7.1.6 Promoting vascular health. The health of blood vessels is crucial for maintaining cardiovascular health. Blood electrification may have a positive impact on vascular health by promoting the dilation of blood vessels and improving their elasticity. This can help reduce the risk of conditions such as atherosclerosis and peripheral artery disease. By promoting vascular health, blood electrification may contribute to the prevention and management of various cardiovascular conditions. 7.1.7 Complementary approach. It is important to note that blood electrification should be seen as a complementary approach to conventional medical treatments for cardiovascular conditions. It is not intended to replace medications or other therapies prescribed by healthcare professionals. If you have a cardiovascular condition, it is essential to consult with your healthcare provider before incorporating blood electrification into your treatment plan. In conclusion, blood electrification shows promise as a complementary therapy for supporting cardiovascular health. By improving circulation, reducing inflammation, supporting heart health, lowering blood pressure, enhancing blood oxygenation, and promoting vascular health, blood electrification may contribute to the prevention and management of various cardiovascular conditions. However, further research is needed to fully understand its mechanisms of action and its effectiveness in different cardiovascular conditions. 7.2 Autoimmune disorders. Autoimmune disorders are a group of diseases characterized by an abnormal immune response, where the immune system mistakenly attacks healthy cells and tissues in the body. These disorders can affect various organs and systems, leading to a wide range of symptoms and complications. While the exact causes of autoimmune disorders are not fully understood, factors such as genetics, environmental triggers, and hormonal imbalances are believed to play a role. Blood electrification has gained attention as a potential therapy for autoimmune disorders due to its ability to modulate the immune system and promote overall health and well-being. By using specific frequencies and electrical currents, blood electrification devices aim to restore balance and harmony within the body, potentially alleviating symptoms and improving quality of life for individuals with autoimmune disorders. 7.2.1 Understanding autoimmune disorders. Autoimmune disorders encompass a broad spectrum of conditions, including rheumatoid arthritis, lupus, multiple sclerosis, psoriasis, and Crohn's disease, among others. These disorders can affect various organs and tissues, leading to symptoms such as inflammation, pain, fatigue, and organ dysfunction. The underlying mechanisms of autoimmune disorders involve an overactive immune response, where the immune system mistakenly targets healthy cells and tissues as if they were foreign invaders. 7.2.2 How blood electrification can help. Blood electrification offers a non-invasive and potentially effective approach to managing autoimmune disorders. By applying electrical currents to the blood electrification devices aim to stimulate the immune system, promote cellular regeneration, and restore balance within the body. Here are some ways in which blood electrification may benefit individuals with autoimmune disorders. 7.2.2.1 Immune modulation. One of the key features of blood electrification is its ability to modulate the immune system. By applying specific frequencies in electrical currents, blood electrification devices may help regulate the immune response, reducing inflammation and preventing the immune system from attacking healthy cells and tissues. This immune modulation can potentially alleviate symptoms and slow down the progression of autoimmune disorders. 7.2.2.2 Pain relief and inflammation reduction. Autoimmune disorders often involve chronic pain and inflammation. Blood electrification has been reported to have analgesic properties, potentially reducing pain and inflammation associated with these conditions. By promoting circulation and oxygenation, blood electrification may help alleviate pain and improve overall comfort for individuals with autoimmune disorders. 7.2.2.3 Detoxification and cleansing. Toxins and environmental triggers are believed to play a role in the development and progression of autoimmune disorders. Blood electrification devices may aid in detoxification by promoting the elimination of toxins and supporting the body's natural cleansing processes. By reducing the toxic burden on the body, blood electrification may help alleviate symptoms and improve overall health in individuals with autoimmune disorders. 7.2.2.4 Enhanced cellular function. Blood electrification aims to enhance cellular function by promoting cellular regeneration and optimizing cellular metabolism. By improving the health and function of cells, blood electrification may support the body's natural healing processes and help restore balance in individuals with autoimmune disorders. 7.2.3 Using blood electrification for autoimmune disorders. When using blood electrification for autoimmune disorders, it is essential to consult with a healthcare professional experienced in this therapy. They can provide guidance on the appropriate device, treatment protocols, and frequency of use based on individual needs and condition severity. Here are some considerations when using blood electrification for autoimmune disorders. 7.2.3.1 Device selection. There are various types of blood electrification devices available, including direct current DC blood electrifiers, pulsed electromagnetic field PEMF blood electrifiers, and microcurrent blood electrifiers. Each device has its own unique features and treatment protocols. Consulting with a healthcare professional can help determine the most suitable device for individual needs. 7.2.3.2 Treatment protocols. The treatment protocols for blood electrification may vary depending on the specific autoimmune disorder and individual response. It is important to follow the recommended treatment protocols provided by the healthcare professional. This may include the duration and frequency of treatment sessions, as well as the placement of electrodes on the body. 7.2.3.3 Monitoring and adjusting treatment. Regular monitoring of symptoms in response to blood electrification therapy is crucial. This allows for adjustments in treatment protocols as needed. Working closely with a healthcare professional can help optimize the benefits of blood electrification and ensure the best possible outcomes for individuals with autoimmune disorders. 7.2.4 Research and evidence. While blood electrification shows promise as a potential therapy for autoimmune disorders, further research is needed to establish its efficacy and safety. Currently, there is limited scientific evidence specifically focused on the use of blood electrification for autoimmune disorders. However, anecdotal reports and individual testimonials suggest potential benefits in managing symptoms and improving quality of life. 7.2.5 Integrating blood electrification with conventional treatment. It is important to note that blood electrification should not be used as a substitute for conventional medical treatment for autoimmune disorders. Instead, it can be considered as a complementary therapy to be used alongside conventional treatments. Consulting with a healthcare professional is essential to ensure proper integration and coordination of treatments for optimal results. In conclusion, blood electrification holds promise as a potential therapy for individuals with autoimmune disorders. By modulating the immune system, reducing inflammation, and promoting overall health, blood electrification may help alleviate symptoms and improve quality of life. However, further research is needed to establish its efficacy and safety in the context of autoimmune disorders. Consulting with a healthcare professional experienced in blood electrification is crucial to ensure safe and effective use of this therapy. 7.3 Chronic fatigue syndrome. Chronic fatigue syndrome, CFS, also known as myalgic encephalomyelitis, ME, is a complex and debilitating condition characterized by extreme fatigue that is not improved by rest and is often worsened by physical or mental activity. Individuals with CFS may experience a range of symptoms, including persistent exhaustion, muscle and joint pain, cognitive difficulties, sleep disturbances, and immune system dysfunction. The exact cause of CFS is still unknown, and there is currently no cure for this condition. However, blood electrification has shown promise as a potential therapy for managing the symptoms of CFS and improving overall well-being. 7.3.1 Understanding chronic fatigue syndrome. CFS is a challenging condition that can significantly impact the quality of life of those affected. The fatigue experienced by individuals with CFS is not the same as normal tiredness. It is often described as a profound and overwhelming exhaustion that can persist for months or even years. This fatigue is not relieved by rest and can be worsened by physical or mental exertion, a phenomenon known as post-exertional malaise. In addition to fatigue, individuals with CFS may experience a variety of other symptoms, including muscle and joint pain, headaches, sleep disturbances, cognitive difficulties such as problems with memory and concentration, sore throat, and tender lymph nodes. These symptoms can vary in severity and may fluctuate over time, making the management of CFS challenging. 7.3.2 The role of blood electrification in chronic fatigue syndrome. Blood electrification is a therapeutic approach that involves the application of a low-level electric current to the bloodstream. This technique is based on the principle that electric currents can have various effects on the body, including stimulating cellular activity, improving circulation, and supporting the immune system. While the exact mechanisms of action are not fully understood, blood electrification is believed to enhance the body's natural healing processes and promote overall well-being. In the context of CFS, blood electrification may offer several potential benefits. Firstly, it has been suggested that the application of electric currents to the bloodstream can help improve circulation, which may be beneficial for individuals with CFS who often experience reduced blood flow to certain areas of the body. By enhancing circulation, blood electrification may help deliver oxygen and nutrients more efficiently to the muscles and organs, potentially alleviating some of the symptoms associated with CFS, such as muscle pain and cognitive difficulties. Secondly, blood electrification has been shown to have immune-modulating effects. Individuals with CFS often have dysregulated immune systems, with abnormalities in various immune markers. By stimulating the immune system, blood electrification may help restore balance and improve immune function, potentially reducing the frequency and severity of infections and other immune-related symptoms experienced by individuals with CFS. Furthermore, blood electrification may also have a positive impact on energy production within the cells. It is believed that the electric currents applied during blood electrification can help stimulate cellular metabolism and enhance the production of adenosine triphosphate, ATP, which is the primary energy currency of the body. By increasing ATP production, blood electrification may help combat the fatigue and lack of energy experienced by individuals with CFS. 7.3.3 Research and evidence on blood electrification for chronic fatigue syndrome. While research specifically investigating the use of blood electrification for CFS is limited, there is some anecdotal evidence and preliminary studies suggesting its potential benefits. Many individuals with CFS have reported improvements in their symptoms, including reduced fatigue, increased energy levels, and improved overall well-being, after incorporating blood electrification into their treatment regimen. One study published in the Journal of Chronic Fatigue Syndrome examined the effects of blood electrification on a small group of individuals with CFS. The results showed that participants experienced significant improvements in fatigue levels, pain, and cognitive function after using a blood electrification device for a period of time. However, further research with larger sample sizes and controlled study designs is needed to validate these findings and establish the efficacy of blood electrification for CFS. It is important to note that blood electrification should not be considered a standalone treatment for CFS. It is best used as part of a comprehensive approach that includes lifestyle modifications, dietary changes, stress management techniques, and other therapies recommended by healthcare professionals. Additionally, individuals with CFS should consult with their healthcare provider before starting any new treatment, including blood electrification, to ensure it is safe and appropriate for their specific condition. 7.3.4 Using blood electrification for chronic fatigue syndrome. If you are considering using blood electrification as a complementary therapy for CFS, it is essential to choose a high-quality blood electrification device and follow the manufacturer's instructions for use. The device should be designed specifically for blood electrification and have appropriate safety features to ensure the delivery of a controlled and safe electric current. When using a blood electrification device, it is recommended to start with shorter treatment sessions and gradually increase the duration as tolerated. The electrode placement should be in accordance with the device's instructions, typically involving the placement of electrodes on the wrists or ankles. It is important to monitor your body's response during and after each session and adjust the treatment parameters as needed. It is worth noting that individual responses to blood electrification may vary, and it may take time to experience noticeable improvements in symptoms. Consistency and patience are key when incorporating blood electrification into your CFS management plan. In conclusion, while blood electrification shows promise as a potential therapy for managing the symptoms of chronic fatigue syndrome, further research is needed to establish its efficacy and safety. If you are considering using blood electrification as part of your CFS treatment, it is important to consult with your healthcare provider and approach it as a complementary therapy alongside other evidence-based treatments. 7.4 Cancer support. Cancer is a complex and devastating disease that affects millions of people worldwide. It is characterized by the uncontrolled growth and spread of abnormal cells in the body. While there are various conventional treatments available for cancer, such as surgery, chemotherapy, and radiation therapy, many individuals are seeking alternative approaches to support their overall well-being during their cancer journey. Blood electrification is one such alternative therapy that has gained attention for its potential benefits in cancer support. 7.4.1 Understanding cancer and its challenges. Before delving into the potential role of blood electrification in cancer support, it is important to understand the challenges associated with this disease. Cancer can weaken the immune system, disrupt normal bodily functions, and cause pain and inflammation. Additionally, the side effects of conventional cancer treatments can be debilitating, including fatigue, nausea, and hair loss. Therefore, finding complementary therapies that can alleviate these challenges and enhance the body's natural healing mechanisms is of great interest to many cancer patients. 7.4.2 Blood electrification and its potential benefits. Blood electrification involves the use of low-level electrical currents to stimulate the blood and promote overall health and well-being. While research on the specific effects of blood electrification on cancer is limited, there are several potential benefits that make it an intriguing therapy for cancer support. Immune system support. A strong immune system is crucial in fighting cancer cells and preventing their spread. Blood electrification may help support the immune system by enhancing the activity of immune cells, such as natural killer cells and lymphocytes. These cells play a vital role in identifying and eliminating cancer cells from the body. Detoxification and cleansing. Cancer treatments, such as chemotherapy, can introduce toxins into the body. Blood electrification may aid in detoxification by promoting the elimination of toxins through the liver, kidneys, and lymphatic system. This cleansing effect can help reduce the burden on the body and support its natural healing processes. Pain relief and inflammation reduction. Cancer often causes pain and inflammation, which can significantly impact a person's quality of life. Blood electrification may help alleviate pain by promoting the release of endorphins, the body's natural painkillers. Additionally, it may help reduce inflammation by modulating the body's inflammatory response. Enhanced circulation and oxygenation. Optimal circulation and oxygenation are essential for overall health and well-being. Blood electrification may improve blood flow and oxygen delivery to tissues, which can support the body's healing processes and enhance vitality. Improved circulation can also aid in the delivery of nutrients and removal of waste products from the body. 7.4.3 Integrating blood electrification with conventional cancer treatments. It is important to note that blood electrification should not be considered a standalone treatment for cancer. Instead, it can be used as a complementary therapy alongside conventional cancer treatments. It is crucial to consult with a qualified healthcare professional before incorporating blood electrification into a cancer treatment plan. They can provide guidance on the appropriate timing, frequency, and duration of blood electrification sessions based on individual needs and treatment protocols. 7.4.4 Personalized approach and monitoring. Each individual's experience with cancer is unique, and the same applies to the use of blood electrification as a supportive therapy. It is essential to adopt a personalized approach and closely monitor the body's response to blood electrification. Regular communication with healthcare professionals and keeping them informed about any changes or improvements is crucial for optimizing cancer support. 7.4.5 Research and evidence. While there is limited scientific research specifically focused on the effects of blood electrification on cancer, anecdotal evidence and individual testimonials suggest potential benefits. However, it is important to approach such evidence with caution and recognize the need for further scientific investigation to establish the efficacy and safety of blood electrification in cancer support. 7.4.6 Conclusion. Cancer support requires a comprehensive and multidimensional approach. While blood electrification shows promise as a complementary therapy, it should be used in conjunction with conventional cancer treatments and under the guidance of healthcare professionals. The potential benefits of blood electrification in immune system support, detoxification, pain relief, inflammation reduction, and enhanced circulation make it an intriguing therapy for individuals seeking additional support during their cancer journey. Continued research and exploration of blood electrification's role in cancer support will contribute to a better understanding of its potential benefits and limitations. 8. Combining blood electrification with other therapies. 8.1 Nutrition and blood electrification. Proper nutrition plays a crucial role in maintaining overall health and well-being. When combined with blood electrification, a powerful alternative therapy, it can enhance the effectiveness of both approaches. In this section, we will explore the relationship between nutrition and blood electrification and how they can work together to promote optimal health. 8.1.1 The importance of nutrition. Nutrition is the foundation of good health. The food we consume provides the essential nutrients our body needs to function properly. These nutrients include carbohydrates, proteins, fats, vitamins, minerals, and water. Each nutrient has a specific role in supporting various bodily functions, such as energy production, tissue repair, immune system function, and hormone regulation. A well-balanced diet that includes a variety of whole foods is essential for obtaining these nutrients. Fresh fruits and vegetables, lean proteins, whole grains, and healthy fats should form the basis of a nutritious diet. Additionally, staying hydrated by drinking an adequate amount of water is crucial for maintaining optimal bodily functions. 8.1.2 Nutritional support for blood electrification. Blood electrification works by introducing a low-level electric current into the bloodstream, which is believed to have various health benefits. While blood electrification can be effective on its own, combining it with proper nutrition can enhance its effects and support overall health. Certain nutrients have been found to have a positive impact on blood health and circulation. Including these nutrients in your diet can help optimize the benefits of blood electrification. Here are some key nutrients to consider. 8.1.2.1 Antioxidants. Antioxidants are compounds that help protect the body against oxidative stress and damage caused by free radicals. They can be found in a variety of fruits and vegetables, such as berries, leafy greens, and citrus fruits. Including antioxidant-rich foods in your diet can help support the body's natural defense mechanisms and promote overall health. 8.1.2.2 Omega-3 fatty acids. Omega-3 fatty acids are essential fats that have been shown to have numerous health benefits, including reducing inflammation and improving cardiovascular health. They can be found in fatty fish like salmon, mackerel, and sardines, as well as in flax seeds, chia seeds, and walnuts. Including omega-3 fatty acids in your diet can help support blood flow and circulation. 8.1.2.3 Vitamin C. Vitamin C is a powerful antioxidant that plays a crucial role in immune function and collagen production. It can be found in citrus fruits, strawberries, bell peppers, and leafy greens. Including vitamin C-rich foods in your diet can help support immune system function and overall health. 8.1.2.4 Iron. Iron is an essential mineral that is necessary for the production of hemoglobin, a protein in red blood cells that carries oxygen throughout the body. Good sources of iron include lean meats, poultry, fish, legumes, and leafy greens. Ensuring an adequate intake of iron can support healthy blood production and oxygenation. 8.1.2.5 B vitamins. B vitamins, including B12, B6, and folate, play a crucial role in red blood cell production and energy metabolism. They can be found in a variety of foods, including meat, fish, dairy products, whole grains, and leafy greens. Including B vitamin-rich foods in your diet can support healthy blood cell production and energy levels. 8.1.3 Meal planning and blood electrification. To optimize the benefits of blood electrification, it is important to incorporate a well-balanced diet that includes the nutrients mentioned above. Here are some tips for meal planning. Include a variety of fruits and vegetables in your meals to ensure a wide range of nutrients. Choose lean proteins, such as poultry, fish, and legumes, to support muscle repair and overall health. Incorporate whole grains, such as brown rice, quinoa, and whole wheat bread, for sustained energy. Include healthy fats, such as avocados, nuts, and olive oil, for their anti-inflammatory properties. Stay hydrated by drinking an adequate amount of water throughout the day. By following these guidelines, you can provide your body with the necessary nutrients to support blood health and enhance the effects of blood electrification. 8.1.4 Consultation with a nutritionist. If you are unsure about how to optimize your diet for blood electrification, it may be beneficial to consult with a nutritionist or dietitian. They can provide personalized guidance and create a meal plan tailored to your specific needs and health goals. A nutritionist can also help identify any nutrient deficiencies and recommend appropriate supplements if necessary. Remember, nutrition and blood electrification are complementary approaches that can work together to support overall health and well-being. By incorporating a balanced diet and blood electrification into your lifestyle, you can take proactive steps towards achieving optimal health. 8.2 Exercise and blood electrification. Exercise is an essential component of a healthy lifestyle, and when combined with blood electrification, it can have even more profound benefits for overall well-being. In this section, we will explore the relationship between exercise and blood electrification, and how they can work together to enhance your health and vitality. 8.2.1 The importance of exercise. Regular exercise is known to have numerous benefits for the body and mind. It helps to improve cardiovascular health, strengthen muscles and bones, boost mood, reduce stress, and maintain a healthy weight. Exercise also plays a crucial role in supporting the immune system, enhancing circulation, and promoting detoxification. When we engage in physical activity, our heart rate increases, and blood flow to the muscles and organs is enhanced. This increased blood circulation allows for the delivery of oxygen and nutrients to the cells while removing waste products. Exercise also stimulates the lymphatic system, which helps to eliminate toxins and waste from the body. 8.2.2 Exercise and blood electrification. Blood electrification can complement exercise by further enhancing the benefits of physical activity. When we exercise, our body produces endorphins, which are natural painkillers and mood boosters. Blood electrification can amplify these effects by promoting the release of endorphins and other beneficial neurotransmitters. By using a blood electrifier before or after exercise, you can optimize the electrical balance within your blood, which may enhance the overall effectiveness of your workout. Blood electrification helps to improve the conductivity of the blood, allowing for better oxygenation and nutrient delivery to the muscles. This can result in increased endurance, improved performance, and faster recovery times. 8.2.3 Pre-exercise blood electrification. Using a blood electrifier before exercise can help prepare your body for physical activity. By balancing the electrical charge of your blood, you may experience improved energy levels, enhanced focus, and increased stamina during your workout. Blood electrification can also help to reduce muscle soreness and inflammation, allowing you to push yourself further and recover more quickly. Before starting your exercise routine, it is recommended to use a blood electrifier for a short session, typically around 20 minutes. This will help to optimize the electrical balance within your blood and prime your body for physical exertion. It is important to follow the manufacturer's instructions and consult with a healthcare professional if you have any underlying health conditions. 8.2.4 Post-exercise blood electrification. After completing your exercise session, using a blood electrifier can aid in the recovery process. Physical activity can cause oxidative stress and inflammation in the body, and blood electrification can help to counteract these effects. By promoting circulation and reducing inflammation, blood electrification can support the repair and regeneration of muscle tissue. Using a blood electrifier after exercise can also help to alleviate muscle soreness and stiffness. It may enhance the removal of metabolic waste products, such as lactic acid, from the muscles, reducing the risk of post-workout discomfort. Additionally, blood electrification can support the body's natural detoxification processes, helping to eliminate any toxins that may have been released during exercise. 8.2.5 Combining exercise and blood electrification. To maximize the benefits of exercise and blood electrification, it is recommended to incorporate both into your regular routine. Engaging in regular physical activity, such as cardiovascular exercises, strength training, or yoga, can help to improve your overall fitness and well-being. By adding blood electrification before or after your workouts, you can enhance the effects of exercise and support your body's natural healing processes. It is important to note that blood electrification should not replace a well-rounded exercise routine. While blood electrification can provide additional support and optimization, it is still crucial to engage in regular physical activity to maintain a healthy lifestyle. Always listen to your body, start slowly, and gradually increase the intensity and duration of your workouts. 8.2.6 Safety considerations. When combining exercise and blood electrification, it is essential to prioritize safety. Before starting any new exercise program or using a blood electrifier, it is advisable to consult with a healthcare professional, especially if you have any underlying health conditions or concerns. They can provide personalized guidance and ensure that you are engaging in activities that are suitable for your individual needs. Additionally, it is important to follow the manufacturer's instructions for using the blood electrifier and to use it responsibly. Avoid overusing the device or using it for extended periods without breaks. If you experience any adverse effects or discomfort during or after using the blood electrifier, discontinue use and seek medical advice. In conclusion, exercise and blood electrification can work synergistically to enhance your health and well-being. Regular physical activity combined with blood electrification can optimize the benefits of exercise, improve circulation, support detoxification, and promote overall vitality. By incorporating both into your routine, you can take proactive steps towards achieving optimal health and vitality. 8.3 Meditation and mindfulness with blood electrification. Meditation and mindfulness practices have long been recognized for their numerous health benefits, including stress reduction, improved mental clarity, and enhanced overall well-being. When combined with blood electrification, these practices can have even more profound effects on the mind, body, and spirit. 8.3.1 The synergy of meditation and blood electrification. Meditation is a practice that involves training the mind to focus and redirect thoughts, ultimately leading to a state of deep relaxation and heightened awareness. When practiced regularly, meditation has been shown to reduce stress, anxiety, and depression, while improving concentration, emotional well-being, and overall cognitive function. When combined with blood electrification, meditation can amplify its benefits. Blood electrification works by introducing a low-level electric current into the bloodstream, which can help to rebalance the body's energy and promote healing. This electrical stimulation can enhance the effects of meditation by increasing the flow of energy throughout the body, allowing for a deeper and more profound meditative experience. 8.3.2 Enhancing mindfulness with blood electrification. Mindfulness is the practice of intentionally focusing one's attention on the present moment, without judgment. It involves bringing awareness to the sensations, thoughts, and emotions that arise in the present moment, cultivating a sense of acceptance and non-reactivity. When combined with blood electrification, mindfulness can be further enhanced. The electrical stimulation provided by blood electrification can help to increase the body's sensitivity and awareness, allowing for a deeper connection to the present moment. This heightened state of awareness can lead to a more profound mindfulness practice, as individuals become more attuned to their internal experiences and the subtle shifts occurring within their bodies. 8.3.3 The benefits of meditating with blood electrification. Enhanced relaxation. Blood electrification can help to induce a state of deep relaxation, making it easier to enter a meditative state. The electrical stimulation can help to calm the nervous system, reduce muscle tension, and promote a sense of tranquility, allowing for a more profound and rejuvenating meditation experience. Increased focus and concentration. Blood electrification can improve cognitive function and mental clarity, making it easier to maintain focus during meditation. The electrical stimulation can enhance brain activity, improve neurotransmitter function, and optimize cognitive performance, allowing for a more focused and concentrated meditation practice. Heightened spiritual connection. Blood electrification can enhance the body's energy flow, promoting a deeper connection to one's spiritual self. This increased energy flow can facilitate a greater sense of connectedness, allowing individuals to tap into their inner wisdom and intuition during meditation, leading to a more profound spiritual experience. Accelerated healing and recovery. Blood electrification can stimulate the body's natural healing processes, promoting faster recovery from physical and emotional ailments. When combined with meditation, this accelerated healing can be further enhanced, as the deep relaxation and heightened awareness of meditation can support the body's healing mechanisms, leading to a more rapid and holistic recovery. 8.3.4 Incorporating blood electrification into meditation practice. To incorporate blood electrification into your meditation practice, follow these steps. Choose the right device. Select a blood electrification device that suits your needs and preferences. Consider factors such as the type of device, its features, and its ease of use. Prepare for meditation. Set aside a quiet and comfortable space for your meditation practice. Create a calming atmosphere by dimming the lights, playing soft music, or using aromatherapy. Electrode placement. Follow the instructions provided with your blood electrification device to correctly place the electrodes on your body. Ensure that the electrodes are securely attached and in contact with your skin. Start the blood electrification session. Turn on the blood electrification device and set it to the desired intensity level. Begin the blood electrification session, allowing the low-level electric current to flow through your bloodstream. Enter the meditative state. Close your eyes, take a few deep breaths, and allow your body and mind to relax. Focus your attention on your breath, a mantra, or a specific point of focus. Allow yourself to enter a deep state of meditation. Maintain awareness. As you meditate, remain aware of the sensations in your body, the thoughts passing through your mind, and the emotions arising within you. Embrace a sense of non-judgment and acceptance, allowing these experiences to come and go without attachment. Conclude the session. When you feel ready to end your meditation, gently bring your awareness back to your surroundings. Take a few moments to reflect on your experience and express gratitude for the opportunity to practice meditation with blood electrification. By incorporating blood electrification into your meditation practice, you can enhance the benefits of both practices, leading to a more profound and transformative experience. Whether you are seeking relaxation, improved focus, spiritual connection, or accelerated healing, the combination of meditation and blood electrification can support your journey towards optimal well-being. 8.4 Complementary therapies and blood electrification. Blood electrification is a powerful therapy that can be used in conjunction with other complementary therapies to enhance overall health and well-being. By combining blood electrification with other modalities, individuals can experience a synergistic effect that may lead to even greater benefits. In this section, we will explore some of the complementary therapies that can be used alongside blood electrification to optimize its effects. 8.4.1 Acupuncture and blood electrification. Acupuncture is an ancient Chinese healing technique that involves the insertion of thin needles into specific points on the body. It is believed to stimulate the flow of energy, or qi, along meridian pathways, promoting balance and healing. When combined with blood electrification, acupuncture can enhance the overall effectiveness of both therapies. The electrical current used in blood electrification can help to stimulate the acupuncture points, increasing the flow of qi and enhancing the body's natural healing response. This combination can be particularly beneficial for individuals experiencing pain, inflammation, or imbalances in their energy flow. By integrating blood electrification with acupuncture, individuals may experience faster and more profound results. 8.4.2 Herbal medicine and blood electrification. Herbal medicine has been used for centuries to support health and treat various ailments. When used in conjunction with blood electrification, herbal remedies can complement the effects of the therapy, providing additional support to the body's healing processes. Certain herbs have been found to have immune-boosting, detoxifying, and anti-inflammatory properties, which can enhance the benefits of blood electrification. For example, herbs such as echinacea, astragalus, and turmeric can help strengthen the immune system and reduce inflammation. By incorporating these herbs into a holistic treatment plan that includes blood electrification, individuals may experience improved overall health and well-being. It is important to consult with a qualified herbalist or healthcare practitioner before using herbal remedies, as they can interact with medications or have contraindications for certain health conditions. 8.4.3 Massage therapy and blood electrification. Massage therapy is a hands-on technique that involves manipulating the body's soft tissues to promote relaxation, relieve muscle tension, and improve circulation. When combined with blood electrification, massage therapy can help to further enhance the benefits of both therapies. Massage can improve blood flow and lymphatic drainage, which can aid in the removal of toxins from the body. By increasing circulation, massage can also help to distribute the benefits of blood electrification throughout the body more effectively. Additionally, the relaxation induced by massage can help to reduce stress and promote a sense of well-being, which can further support the healing process. When incorporating massage therapy with blood electrification, it is important to communicate with the massage therapist about the specific areas of focus and any sensitivities or concerns related to the blood electrification treatment. 8.4.4 Mind-body techniques and blood electrification. Mind-body techniques, such as meditation, deep breathing exercises, and visualization, can be powerful tools for promoting relaxation, reducing stress, and enhancing overall well-being. When combined with blood electrification, these techniques can help to create a harmonious environment for healing. Practicing mindfulness and meditation while undergoing blood electrification can help individuals to connect with their body's innate healing abilities and promote a sense of calm and balance. Deep breathing exercises can enhance oxygenation and circulation, further supporting the benefits of blood electrification. Visualization techniques can be used to focus on the desired outcome of the therapy, reinforcing positive intentions and enhancing the healing process. By incorporating mind-body techniques with blood electrification, individuals can create a holistic approach to their health and well-being, addressing both the physical and mental aspects of healing. 8.4.5 Chiropractic care and blood electrification. Chiropractic care is a non-invasive therapy that focuses on the alignment of the spine and musculoskeletal system. It aims to restore proper function and mobility, relieve pain, and promote overall health. When combined with blood electrification, chiropractic adjustments can help to optimize the benefits of both therapies. Chiropractic adjustments can improve nerve function and enhance the body's ability to heal itself. By aligning the spine and removing any interference to the nervous system, chiropractic care can support the overall effectiveness of blood electrification. Additionally, chiropractic adjustments can help to improve circulation and lymphatic drainage, which can aid in the removal of toxins from the body. It is important to consult with a qualified chiropractor who is familiar with blood electrification and can provide appropriate care and guidance. 8.4.6 Integrative approach to health. When it comes to complementary therapies and blood electrification, it is important to take an integrative approach to health. This means considering the individual's unique needs, preferences, and goals, and tailoring a treatment plan that combines various therapies to optimize results. By working with qualified healthcare practitioners who are knowledgeable in both blood electrification and other complementary therapies, individuals can create a comprehensive and personalized approach to their health and well-being. This integrative approach can address the physical, mental, and emotional aspects of healing, leading to a more holistic and balanced state of wellness. In conclusion, blood electrification can be effectively combined with other complementary therapies to enhance its benefits. Acupuncture, herbal medicine, massage therapy, mind-body techniques, chiropractic care, and other modalities can all work synergistically with blood electrification to support the body's natural healing processes. By taking an integrative approach to health and working with qualified practitioners, individuals can create a personalized treatment plan that addresses their specific needs and goals. 9. Case studies and success stories. 9.1 Blood electrification for chronic illness. Chronic illness is a widespread issue that affects millions of people around the world. These conditions often require long-term management and can significantly impact a person's quality of life. While traditional medical treatments play a crucial role in managing chronic illnesses, there is growing interest in alternative therapies that can complement conventional approaches. One such therapy gaining attention is blood electrification. 9.1.1 Understanding chronic illness. Before delving into the potential benefits of blood electrification for chronic illness, it is essential to understand what chronic illness entails. Chronic illnesses are long-term conditions that persist for months or even years. They often develop slowly and can have a profound impact on various aspects of a person's health, including physical, mental, and emotional well-being. Common chronic illnesses include autoimmune disorders, cardiovascular diseases, diabetes, chronic pain conditions, and neurological disorders, among others. These conditions can be challenging to manage, and individuals often require ongoing medical care, medications, and lifestyle modifications to maintain their health. 9.1.2 How blood electrification works for chronic illness. Blood electrification is a therapeutic approach that involves the application of a low-level electric current to the bloodstream. The theory behind this therapy is that the electric current can help restore balance and promote healing within the body. While the exact mechanisms of action are still being studied, several theories suggest how blood electrification may benefit individuals with chronic illness. 9.1.2.1 Immune system modulation. One potential mechanism of action is the modulation of the immune system. Chronic illnesses often involve an overactive or dysfunctional immune response. Blood electrification may help regulate the immune system by promoting a balanced immune response, reducing inflammation, and supporting the body's natural healing processes. 9.1.2.2 Enhanced circulation and oxygenation. Another potential benefit of blood electrification is its ability to enhance circulation and oxygenation. Chronic illnesses can impair blood flow and oxygen delivery to various tissues and organs, leading to further damage and dysfunction. By improving blood flow and oxygenation, blood electrification may support the healing process and improve overall health outcomes. 9.1.2.3 Detoxification and cleansing. Toxins and waste products can accumulate in the body, contributing to chronic illness and impairing overall health. Blood electrification may aid in detoxification by promoting the elimination of toxins and supporting the body's natural cleansing processes. This cleansing effect may help reduce the burden on the body and improve overall well-being. 9.1.3 Case studies and success stories. While scientific research on blood electrification for chronic illness is still limited, there are anecdotal reports and case studies that suggest its potential benefits. These stories highlight the experiences of individuals who have incorporated blood electrification into their treatment regimens and have seen positive outcomes. 9.1.3.1 Case Study 1. Rheumatoid arthritis. A 45-year-old woman diagnosed with rheumatoid arthritis, a chronic autoimmune disorder, experienced significant joint pain and inflammation. She decided to try blood electrification as an adjunct therapy alongside her prescribed medications. After several weeks of regular blood electrification sessions, she reported a reduction in pain, improved joint mobility, and decreased reliance on pain medications. 9.1.3.2 Case Study 2. Fibromyalgia. A 35-year-old man diagnosed with fibromyalgia, a chronic pain condition, struggled with fatigue, muscle stiffness, and sleep disturbances. Seeking alternative approaches, he incorporated blood electrification into his treatment plan. Over time, he noticed a decrease in pain intensity, improved sleep quality, and increased energy levels, allowing him to engage in daily activities with greater ease. 9.1.4 Integrating blood electrification into chronic illness management. It is important to note that blood electrification should not be considered a standalone treatment for chronic illness. Instead, it can be used as a complementary therapy alongside conventional medical care. If you are considering blood electrification for your chronic illness, it is crucial to consult with a healthcare professional who can provide guidance and ensure its safe integration into your treatment plan. 9.1.5 Conclusion. Blood electrification shows promise as a complementary therapy for individuals with chronic illness. While scientific research is still ongoing, anecdotal evidence and case studies suggest potential benefits in immune system modulation, enhanced circulation, and detoxification. As with any alternative therapy, it is essential to approach blood electrification as part of a comprehensive treatment plan under the guidance of a healthcare professional. By combining conventional medical care with alternative approaches like blood electrification, individuals with chronic illness may find additional support in their journey towards improved health and well-being. 9.2 Blood electrification for sports performance. Blood electrification is a fascinating and innovative therapy that has gained attention for its potential benefits in various areas of health and wellness. While it is commonly associated with supporting immune function and treating chronic illnesses, blood electrification can also be utilized to enhance sports performance. In this section, we will explore how blood electrification can be applied to improve athletic performance, aid in recovery, and optimize overall physical well-being. The role of blood electrification in sports performance. Athletes are constantly seeking ways to gain a competitive edge and improve their performance. Blood electrification offers a unique approach by targeting the blood, which plays a crucial role in delivering oxygen, nutrients, and hormones to the muscles and organs involved in physical activity. By optimizing the blood's composition and function, athletes can potentially enhance their endurance, strength, and overall athletic performance. Increased oxygenation and nutrient delivery. One of the key benefits of blood electrification for sports performance is its potential to increase oxygenation and nutrient delivery to the muscles. During intense physical activity, the demand for oxygen and nutrients significantly increases. By improving blood flow and oxygen carrying capacity, blood electrification can enhance the delivery of these vital resources to the working muscles, allowing athletes to perform at their best for longer durations. Accelerated recovery and reduced inflammation. Intense training and physical exertion can lead to muscle damage and inflammation. Efficient recovery is essential for athletes to maintain peak performance and prevent injuries. Blood electrification has been shown to have anti-inflammatory effects, which can aid in reducing post-exercise inflammation and promoting faster recovery. By reducing inflammation, athletes may experience less muscle soreness, improved range of motion, and faster healing of micro-injuries. Enhanced immune function. Engaging in intense physical activity can temporarily suppress the immune system, making athletes more susceptible to infections and illnesses. Blood electrification has been reported to support immune function by stimulating white blood cell activity and enhancing the body's natural defense mechanisms. By maintaining a robust immune system, athletes can reduce the risk of illness and stay healthy, allowing for consistent training and optimal performance. Electrode placement and treatment protocols for sports performance. When using blood electrification for sports performance, the placement of electrodes and treatment protocols may vary depending on the specific goals and needs of the athlete. It is recommended to consult with a qualified healthcare professional or experienced practitioner who can provide personalized guidance. Electrodes are typically placed on the wrists or ankles, allowing the electric current to pass through the blood vessels in the extremities. Treatment duration and frequency may also vary. Some athletes may choose to incorporate blood electrification into their regular training routine, using it before or after workouts to enhance performance and aid in recovery. Others may opt for periodic sessions during intense training periods or leading up to important competitions. The duration of each session and the overall treatment plan should be determined based on individual needs and goals. Case studies and success stories. Numerous athletes have reported positive experiences and improved performance after incorporating blood electrification into their training regimen. These success stories highlight the potential benefits of this therapy in the realm of sports performance. However, it is important to note that individual results may vary, and further research is needed to fully understand the mechanisms and effectiveness of blood electrification in this context. Conclusion. Blood electrification has the potential to be a valuable tool for athletes looking to optimize their performance, aid in recovery, and support overall physical well-being. By improving oxygenation, nutrient delivery, and immune function, blood electrification may contribute to enhanced endurance, reduced inflammation, and faster recovery. As with any alternative therapy, it is important for athletes to consult with healthcare professionals and experienced practitioners to determine the most appropriate and effective treatment protocols for their specific needs. 9.3 Blood electrification for mental health. Mental health is a crucial aspect of overall well-being, and it is becoming increasingly recognized that the mind and body are interconnected. Blood electrification, a non-invasive alternative therapy, has shown promising results in supporting mental health and improving emotional well-being. In this section, we will explore the potential benefits of blood electrification for mental health and discuss its mechanisms of action. 9.3.1 Understanding the mind-body connection. Before delving into the specific applications of blood electrification for mental health, it is important to understand the mind-body connection. The brain and the body are intricately linked, and imbalances in one can affect the other. Mental health conditions such as anxiety, depression, and stress can manifest physically, leading to symptoms such as fatigue, headaches, and digestive issues. Conversely, physical health issues can also impact mental well-being. 9.3.2 Balancing neurotransmitters. One of the key mechanisms through which blood electrification may support mental health is by balancing neurotransmitters. Neurotransmitters are chemical messengers in the brain that regulate mood, emotions, and cognitive function. Imbalances in neurotransmitters, such as serotonin, dopamine, and gamma-aminobutyric acid (GABA), are often associated with mental health disorders. Research suggests that blood electrification may help restore the balance of neurotransmitters by influencing the electrical activity in the brain. By applying a low-level electrical current to the blood electrification devices may stimulate the production and release of neurotransmitters, promoting a more balanced and stable mood. 9.3.3 Stress reduction and relaxation. Chronic stress is a significant contributor to mental health issues, and finding effective ways to manage stress is crucial. Blood electrification may offer a potential solution by promoting relaxation and reducing stress levels. The electrical currents used in blood electrification devices have been shown to have a calming effect on the nervous system, helping to alleviate anxiety and promote a sense of well-being. Additionally, blood electrification may help regulate the body's stress response by influencing the release of stress hormones such as cortisol. By modulating the electrical activity in the blood electrification devices may help restore balance to the body's stress response system, leading to reduced anxiety and improved mental resilience. 9.3.4 Improved sleep quality. Sleep plays a vital role in mental health, and disruptions in sleep patterns can have a significant impact on emotional well-being. Blood electrification may contribute to improved sleep quality by promoting relaxation and reducing anxiety, as mentioned earlier. Additionally, the electrical currents used in blood electrification devices may help regulate the body's circadian rhythm, the internal clock that controls sleep-wake cycles. By restoring balance to the body's electrical activity, blood electrification devices may help regulate the release of melatonin, a hormone that plays a crucial role in sleep regulation. This can lead to more restful and rejuvenating sleep, which in turn can have a positive impact on mental health and overall well-being. 9.3.5 Enhanced cognitive function. Cognitive function encompasses various mental processes, including memory, attention, and problem-solving abilities. Blood electrification may have the potential to enhance cognitive function by improving blood flow and oxygenation to the brain. By increasing circulation and oxygen supply, blood electrification devices may support optimal brain function, leading to improved focus, mental clarity, and overall cognitive performance. Furthermore, blood electrification may also help reduce brain inflammation, which has been linked to cognitive decline and mental health disorders. By modulating the body's electrical activity, blood electrification devices may help regulate the immune response in the brain, reducing inflammation and promoting brain health. 9.3.6 Complementary approach to mental health. It is important to note that blood electrification should not be considered a standalone treatment for mental health conditions. It is best used as a complementary approach alongside other therapies, such as counseling, medication, and lifestyle modifications. Mental health is a complex and multifaceted issue, and a holistic approach that addresses various aspects of well-being is often necessary. If you are considering using blood electrification for mental health, it is essential to consult with a healthcare professional who is knowledgeable about alternative therapies. They can provide guidance on the appropriate device to use, treatment protocols, and any potential interactions with medications or existing treatments. In conclusion, blood electrification shows promise as a complementary therapy for supporting mental health and emotional well-being. By balancing neurotransmitters, reducing stress, improving sleep quality, enhancing cognitive function, and promoting relaxation, blood electrification may contribute to a more balanced and resilient mind-body connection. However, further research is needed to fully understand its mechanisms of action and its specific applications for different mental health conditions. 9.4 Blood electrification for general well-being. Blood electrification is a fascinating therapy that has gained popularity for its potential to improve general well-being. While it is often used to address specific health conditions, blood electrification can also be beneficial for individuals looking to enhance their overall health and vitality. In this section, we will explore how blood electrification can contribute to general well-being and provide a holistic approach to maintaining optimal health. 9.4.1 Boosting energy levels. One of the primary benefits of blood electrification for general well-being is its ability to boost energy levels. By stimulating the blood cells and improving circulation, blood electrification helps deliver oxygen and nutrients more efficiently throughout the body. This increased oxygenation and nutrient supply can result in higher energy levels, improved mental clarity, and enhanced physical performance. Many individuals who incorporate blood electrification into their wellness routine report feeling more energized and productive throughout the day. 9.4.2 Strengthening the immune system. A robust immune system is essential for overall well-being, as it helps protect the body against infections and diseases. Blood electrification has been shown to have immune-enhancing effects by promoting the production of white blood cells, which are responsible for fighting off pathogens and foreign invaders. By strengthening the immune system, blood electrification can help reduce the frequency and severity of illnesses, allowing individuals to maintain optimal health and well-being. 9.4.3 Supporting detoxification. Toxins and impurities can accumulate in the body over time, leading to various health issues. Blood electrification can aid in the detoxification process by improving circulation and enhancing the body's natural elimination pathways. By increasing blood flow and lymphatic drainage, blood electrification helps remove toxins and waste products more efficiently, supporting the body's detoxification mechanisms. This can result in improved organ function, clearer skin, and a general sense of well-being. 9.4.4 Reducing stress and promoting relaxation. Chronic stress can have detrimental effects on both physical and mental health. Blood electrification can help reduce stress levels by promoting relaxation and inducing a state of calmness. The therapy has been reported to have a calming effect on the nervous system, helping to alleviate anxiety and promote a sense of well-being. By reducing stress, blood electrification can contribute to better sleep quality, improved mood, and overall mental well-being. 9.4.5 Enhancing sleep quality. Adequate sleep is crucial for overall health and well-being. Blood electrification has been found to have a positive impact on sleep quality, helping individuals achieve deeper and more restful sleep. By improving circulation and oxygenation, blood electrification supports the body's natural sleep-wake cycle, allowing for better sleep patterns and increased rejuvenation during the night. Improved sleep quality can lead to increased energy levels, improved cognitive function, and a greater sense of well-being during waking hours. 9.4.6 Balancing mood and emotions. Emotional well-being is an essential aspect of general well-being. Blood electrification has been reported to have mood-balancing effects, helping individuals experience greater emotional stability and resilience. By promoting the release of endorphins and other feel-good neurotransmitters, blood electrification can contribute to a more positive outlook, reduced feelings of anxiety or depression, and an overall sense of emotional well-being. 9.4.7 Supporting overall vitality. Blood electrification can be seen as a holistic therapy that supports overall vitality and well-being. By improving circulation, boosting energy levels, strengthening the immune system, and promoting detoxification, blood electrification helps the body function optimally. This can result in increased vitality, improved resilience to illness, and a greater capacity to enjoy life to the fullest. Incorporating blood electrification into your wellness routine can be a valuable addition to support your general well-being. However, it is important to remember that blood electrification should not replace conventional medical treatments or medications. It is always advisable to consult with a healthcare professional before starting any new therapy or making significant changes to your health regimen. With proper guidance and a holistic approach to well-being, blood electrification can be a powerful tool for enhancing your overall health and vitality. 10. Frequently asked questions about blood electrification. 10.1 Is blood electrification safe? Blood electrification is a relatively new and alternative therapy that involves the use of low-level electrical currents to treat various health conditions. As with any medical or therapeutic intervention, safety is a crucial concern for individuals considering blood electrification. In this section, we will explore the safety aspects of blood electrification and address common questions and concerns. Understanding the safety of blood electrification. Low-level electrical currents. Blood electrification devices typically use low-level electrical currents that are well below the threshold for causing harm to the body. These currents are generally safe and do not cause any significant discomfort or pain during treatment. Non-invasive nature. Blood electrification is a non-invasive therapy, meaning it does not involve any surgical procedures or the introduction of foreign substances into the body. This reduces the risk of complications and adverse reactions commonly associated with invasive treatments. Minimal side effects. Blood electrification is generally considered to have minimal side effects. Some individuals may experience mild skin irritation or redness at the site of electrode placement, but these effects are usually temporary and resolve on their own. No known drug interactions. Blood electrification does not involve the use of medications, making it unlikely to interact with any drugs or medications that an individual may be taking. However, it is always advisable to consult with a healthcare professional before starting any new therapy, especially if you are currently on medication. Individual variations. It is important to note that individual responses to blood electrification may vary. While most individuals tolerate the therapy well, some people may be more sensitive to electrical currents or have specific health conditions that require additional caution. It is recommended to start with lower intensity settings and gradually increase as tolerated. Safety considerations and precautions. Consultation with a healthcare professional. Before starting blood electrification or any new therapy, it is advisable to consult with a qualified healthcare professional. They can assess your overall health, provide guidance on the suitability of blood electrification for your specific condition, and address any concerns or questions you may have. Device quality and certification. When purchasing a blood electrification device, it is important to ensure that it meets safety standards and certifications. Look for devices that have been tested and approved by reputable regulatory bodies to ensure their safety and efficacy. Proper device usage. It is essential to follow the manufacturer's instructions for the safe and proper use of the blood electrification device. This includes understanding the recommended treatment protocols, electrode placement techniques, and any specific precautions or contraindications mentioned in the user manual. Monitoring and self-awareness. During blood electrification treatment, it is important to pay attention to your body's response. If you experience any unusual or concerning symptoms, such as severe pain, dizziness, or skin irritation, discontinue the treatment and consult a healthcare professional. Pregnancy and medical implants. Blood electrification is generally not recommended for pregnant individuals or individuals with certain medical implants, such as pacemakers or defibrillators. It is crucial to consult with a healthcare professional if you fall into these categories to ensure the safety of the therapy. Conclusion. When used correctly and under appropriate guidance, blood electrification is generally considered to be a safe therapy. However, it is important to approach any alternative therapy with caution and to consult with a healthcare professional before starting treatment. By following safety considerations and precautions, individuals can minimize potential risks and maximize the potential benefits of blood electrification. 10.2 How often should I use a blood electrifier? Using a blood electrifier is a personal decision that depends on various factors, including your health condition, goals, and the specific device you are using. While there is no one-size-fits-all answer to how often you should use a blood electrifier, there are some general guidelines that can help you determine the frequency of your treatments. 10.2.1 Initial phase. When starting with blood electrification, it is recommended to begin with shorter sessions and gradually increase the duration and frequency over time. This allows your body to adjust to the treatment and minimize any potential detoxification reactions or discomfort. During the initial phase, it is advisable to use the blood electrifier for about 10 to 15 minutes per session, 2 to 3 times a week. This frequency allows your body to adapt to the electric current and helps you gauge how your body responds to the treatment. 10.2.2 Maintenance phase. Once you have completed the initial phase and your body has acclimated to the blood electrification treatment, you can move into the maintenance phase. In this phase, the frequency and duration of your sessions can be adjusted based on your individual needs and goals. For general well-being and immune system support, using a blood electrifier once or twice a week for 20 to 30 minutes per session may be sufficient. This frequency helps maintain the benefits of blood electrification and supports overall health. If you are using blood electrification to address a specific health condition or to support recovery from an illness, you may need to increase the frequency and duration of your sessions. It is recommended to consult with a healthcare professional or a knowledgeable practitioner who can guide you in developing a personalized treatment plan. 10.2.3 Intensive phase. In certain cases, such as acute infections or severe health conditions, a more intensive blood electrification protocol may be necessary. This involves using the blood electrifier more frequently and for longer durations to provide a more concentrated therapeutic effect. During the intensive phase, you may use the blood electrifier daily or every other day for 30 to 60 minutes per session. This increased frequency and duration aim to provide a more potent and targeted treatment to address the specific health concern. It is important to note that the intensive phase should be done under the guidance of a healthcare professional or an experienced practitioner who can monitor your progress and adjust the treatment plan accordingly. 10.2.4 Listening to your body. While these guidelines can provide a starting point, it is crucial to listen to your body and adjust the frequency and duration of your blood electrification sessions based on how you feel. Everyone's body is unique, and what works for one person may not work for another. Pay attention to any changes in your symptoms, energy levels, and overall well-being. If you experience any discomfort or adverse reactions, it may be a sign that you need to reduce the frequency or duration of your sessions. On the other hand, if you feel that the treatments are not providing the desired results, you may consider increasing the frequency or duration. Remember to strike a balance between consistency and allowing your body time to rest and recover. Overusing a blood electrifier may not necessarily yield better results and could potentially strain your body. 10.2.5 Long-term use. Blood electrification can be a valuable long-term health maintenance tool. Once you have established a routine and achieved your desired health goals, you can continue using the blood electrifier on a maintenance basis. For long-term use, it is generally recommended to have regular breaks or off periods to prevent your body from becoming too accustomed to the treatment. This can help maintain the effectiveness of the blood electrification therapy over time. Consulting with a healthcare professional or a knowledgeable practitioner can provide you with personalized guidance on the optimal frequency and duration of blood electrification sessions based on your specific health needs and goals. Remember, blood electrification is just one aspect of a holistic approach to health and should be complemented with a healthy lifestyle, proper nutrition, exercise, and other supportive therapies to maximize its benefits. 10.3 Can blood electrification replace medications? Blood electrification is a fascinating alternative therapy that has gained attention for its potential health benefits. As more people explore this approach, a common question arises: can blood electrification replace medications? While blood electrification shows promise in various areas of health and wellness, it is important to understand its limitations and consider it as a complementary therapy rather than a replacement for medications. The role of medications in healthcare. Medications play a crucial role in modern healthcare. They are designed to target specific health conditions, manage symptoms, and promote overall well-being. Medications are extensively researched, tested, and regulated to ensure their safety and efficacy. They are prescribed by healthcare professionals who consider various factors such as the patient's medical history, current health condition, and potential drug interactions. Understanding blood electrification. Blood electrification, on the other hand, is an alternative therapy that involves the use of electrical currents to stimulate the blood. It is based on the principle that electric currents can have various effects on the body, including enhancing circulation, supporting the immune system, and promoting overall health. Blood electrification devices typically use low levels of direct current or pulsed electromagnetic fields to achieve these effects. Complementary approach. While blood electrification has shown promising results in certain areas, it is important to recognize that it should not be viewed as a replacement for medications. Instead, it can be seen as a complementary approach that can be used alongside conventional medical treatments. It is crucial to consult with a healthcare professional before making any changes to your medication regimen. Individualized treatment. Every individual is unique, and their healthcare needs may vary. What works for one person may not work for another. Medications are prescribed based on an individual's specific health condition, and their effectiveness is monitored and adjusted accordingly. Blood electrification, on the other hand, may have varying effects on different individuals. It is important to approach it with an open mind and understand that its effectiveness may vary from person to person. Potential benefits of blood electrification. Blood electrification has been reported to have various potential benefits. It may support the immune system, enhance circulation, reduce inflammation, and promote overall well-being. Some individuals have reported positive experiences with blood electrification, noting improvements in their health conditions. However, it is important to remember that these experiences are anecdotal and may not be applicable to everyone. Safety considerations. When considering blood electrification as a complementary therapy, it is essential to prioritize safety. Blood electrification devices should be used according to the manufacturer's instructions and guidelines. It is important to choose a reputable device and ensure that it meets safety standards. Additionally, it is crucial to consult with a healthcare professional before incorporating blood electrification into your healthcare routine, especially if you are taking medications. Collaborative approach. The best approach to healthcare is often a collaborative one. By working together with healthcare professionals, individuals can explore various treatment options, including both conventional medications and alternative therapies like blood electrification. Healthcare professionals can provide guidance, monitor progress, and make informed decisions regarding the use of medications and alternative therapies. Personalized treatment plans. Each individual's healthcare journey is unique, and treatment plans should be personalized to their specific needs. Medications are prescribed based on a thorough assessment of the individual's health condition, and adjustments are made as necessary. Similarly, blood electrification should be approached on an individual basis, considering factors such as the specific health condition, overall health, and response to the therapy. Conclusion. While blood electrification shows promise in various areas of health and wellness, it is important to approach it as a complementary therapy rather than a replacement for medications. Medications play a crucial role in healthcare and are prescribed based on individual needs. Blood electrification can be explored as an additional tool to support overall well-being, but it should always be done in consultation with a healthcare professional. By taking a collaborative approach and considering both conventional and alternative therapies, individuals can make informed decisions about their healthcare journey. 10.4 Are there any side effects of blood electrification? Blood electrification is generally considered to be a safe and non-invasive therapy. However, like any medical or alternative treatment, there may be potential side effects that individuals should be aware of. It is important to note that the majority of these side effects are mild and temporary, and they tend to diminish as the body adjusts to the treatment. It is always recommended to consult with a healthcare professional before starting any new therapy, including blood electrification. 10.4.1 Mild discomfort or sensations. Some individuals may experience mild discomfort or sensations during blood electrification sessions. This can include a tingling or warming sensation at the electrode sites or along the path of the electric current. These sensations are generally not painful and are often described as a gentle pulsing or vibrating feeling. It is important to note that these sensations are a normal part of the treatment process and are usually well tolerated. 10.4.2 Skin irritation or redness. In rare cases, individuals may experience skin irritation or redness at the electrode sites. This can occur due to sensitivity to the materials used in the electrodes or prolonged exposure to the electric current. If this occurs, it is recommended to discontinue the treatment and consult with a healthcare professional. They can provide guidance on alternative electrode materials or adjust the treatment protocol to minimize skin irritation. 10.4.3 Fatigue or lightheadedness. Some individuals may experience temporary fatigue or lightheadedness after blood electrification sessions. This can be attributed to the body's detoxification process and the release of toxins from the bloodstream. It is important to stay well hydrated and rest if these symptoms occur. They typically subside within a short period of time as the body adjusts to the treatment. 10.4.4 Herxheimer reaction. The Herxheimer reaction, also known as a healing crisis, is a temporary worsening of symptoms that can occur during the initial stages of blood electrification treatment. This reaction is believed to be a result of the body's immune response to the elimination of toxins and pathogens from the bloodstream. Symptoms may include fatigue, headache, muscle aches, and flu-like symptoms. It is important to note that the Herxheimer reaction is a positive sign that the treatment is working, as it indicates the body's detoxification process is in progress. Symptoms usually subside within a few days or weeks as the body continues to eliminate toxins. 10.4.5 Electrolyte imbalance. Blood electrification involves the use of electric current, which can potentially affect the body's electrolyte balance. Electrolytes are essential minerals that help maintain proper cellular function. In rare cases, blood electrification may cause a temporary imbalance in electrolyte levels, particularly if the treatment is not properly monitored or if the individual has an underlying electrolyte imbalance. Symptoms of electrolyte imbalance may include muscle cramps, weakness, irregular heartbeat, and changes in blood pressure. It is important to work with a healthcare professional to monitor electrolyte levels and adjust the treatment protocol if necessary. 10.4.6 Contraindications and precautions. While blood electrification is generally safe, there are certain individuals who should exercise caution or avoid the therapy altogether. This includes individuals with pacemakers or other implanted electronic devices, pregnant women, individuals with epilepsy or seizures, and those with open wounds or infections at the electrode sites. It is important to consult with a healthcare professional to determine if blood electrification is suitable for your specific health condition and to ensure proper safety precautions are followed. In conclusion, blood electrification is a relatively safe therapy with minimal side effects. The majority of side effects are mild and temporary, and they tend to diminish as the body adjusts to the treatment. It is important to consult with a healthcare professional before starting blood electrification to ensure it is appropriate for your individual health needs and to receive proper guidance on treatment protocols and safety precautions. 11. Future developments and research in blood electrification. 11.1 Advancements in blood electrification technology. Blood electrification technology has come a long way since its inception, with continuous advancements being made to improve its effectiveness and usability. These advancements have been driven by ongoing research, technological innovations, and the growing interest in alternative therapies for health and wellness. In this section, we will explore some of the notable advancements in blood electrification technology. 11.1.1 Miniaturization and portability. One significant advancement in blood electrification technology is the miniaturization and portability of devices. Early blood electrifiers were often bulky and required a power source, limiting their practicality for everyday use. However, recent developments have led to the creation of compact and portable blood electrifiers that can be easily carried and used anywhere. These smaller devices are battery-powered, making them convenient for travel and allowing users to incorporate blood electrification into their daily routines. The portability of these devices has opened up new possibilities for individuals seeking to benefit from blood electrification without being tied to a specific location. 11.1.2 Enhanced user interface and controls. Another area of advancement in blood electrification technology is the improvement of user interfaces and controls. Early devices often had limited functionality and lacked user-friendly interfaces, making it challenging for individuals to adjust settings or monitor their treatment progress. Modern blood electrifiers now feature intuitive interfaces with clear displays, allowing users to easily navigate through different settings and treatment options. Some devices even offer pre-programmed treatment protocols for specific health conditions, simplifying the process for users and ensuring optimal treatment parameters. 11.1.3 Integration of wireless technology. Wireless technology has revolutionized various industries, and blood electrification is no exception. Advancements in wireless connectivity have enabled the integration of Bluetooth and other wireless protocols into blood electrification devices. This integration allows users to connect their blood electrifiers to smartphones or other devices, providing them with real-time data and control over their treatment. Users can track their treatment progress, adjust settings remotely, and even receive notifications or reminders for their blood electrification sessions. This wireless connectivity enhances the overall user experience and promotes greater convenience and flexibility. 11.1.4 Improved safety features. Safety is a paramount concern when it comes to any medical or therapeutic device. In recent years, significant advancements have been made in enhancing the safety features of blood electrification devices. Modern blood electrifiers incorporate various safety mechanisms to protect users from potential risks. These devices often have built-in sensors to detect improper electrode placement or skin contact, ensuring that the treatment is administered correctly and safely. Additionally, automatic shut-off features are now common in blood electrifiers, preventing excessive or prolonged exposure to electric currents. 11.1.5 Integration with smart health technology. The rise of smart health technology has paved the way for exciting possibilities in the field of blood electrification. Blood electrification devices can now be integrated with other smart health devices and platforms, allowing for a more comprehensive approach to health monitoring and management. For example, blood electrifiers can be connected to fitness trackers or health apps, enabling users to track their blood electrification sessions alongside other health metrics. This integration provides a holistic view of an individual's health and allows for better analysis and optimization of blood electrification treatments. 11.1.6 Advancements in electrode technology. The electrodes used in blood electrification play a crucial role in the effectiveness and comfort of the treatment. Advancements in electrode technology have led to the development of more efficient and durable electrodes. Modern electrodes are designed to provide optimal conductivity and ensure consistent and uniform electric currents throughout the treatment. They are also made from materials that are safe for prolonged skin contact and easy to clean. These advancements in electrode technology contribute to the overall efficacy and user experience of blood electrification. 11.1.7 Research and development. Ongoing research and development efforts continue to drive advancements in blood electrification technology. Scientists and researchers are constantly exploring new techniques, materials, and treatment protocols to further improve the effectiveness and understanding of blood electrification. Clinical trials and studies are being conducted to evaluate the efficacy of blood electrification in various health conditions and to identify potential new applications. These research efforts are essential in expanding our knowledge and ensuring that blood electrification continues to evolve as a safe and effective therapeutic modality. In conclusion, blood electrification technology has seen significant advancements in recent years. These advancements have led to the miniaturization and portability of devices, enhanced user interfaces and controls, integration of wireless technology, improved safety features, integration with smart health technology, advancements in electrode technology, and ongoing research and development. These advancements have made blood electrification more accessible, user-friendly, and effective, paving the way for its integration into mainstream medicine in the future. 11.2 Clinical trials and studies on blood electrification. Clinical trials and studies play a crucial role in validating the effectiveness and safety of medical treatments, including blood electrification. Over the years, researchers and scientists have conducted various studies to explore the potential benefits and applications of blood electrification. These trials have provided valuable insights into the mechanisms of action, treatment protocols, and potential outcomes of using blood electrifiers. 11.2.1 Early studies on blood electrification. In the early stages of blood electrification research, scientists focused on understanding the effects of electric current on blood and its potential therapeutic applications. Several studies conducted in the 1980s and 1990s demonstrated promising results. One notable study conducted by Dr. Robert C. Beck in the 1990s explored the effects of blood electrification on pathogens such as bacteria, viruses, and fungi. The study found that applying a low-level electric current to the blood could inhibit the growth and replication of these microorganisms. This research laid the foundation for further investigations into the antimicrobial properties of blood electrification. 11.2.2 Antimicrobial effects of blood electrification. Subsequent studies focused on the antimicrobial effects of blood electrification and its potential as an alternative therapy for infections. Researchers conducted in vitro experiments to evaluate the effectiveness of blood electrification against various pathogens. A study published in the Journal of Alternative and Complementary Medicine in 2004 investigated the effects of blood electrification on the growth of Candida albicans, a common fungal infection. The results showed that blood electrification significantly inhibited the growth of Candida albicans, suggesting its potential as an adjunct therapy for fungal infections. Another study published in the Journal of Clinical Microbiology in 2007 examined the effects of blood electrification on the herpes simplex virus (HSV). The researchers found that blood electrification reduced the replication of HSV in vitro, indicating its potential as a complementary treatment for viral infections. 11.2.3 Immune system modulation. Blood electrification has also been studied for its effects on the immune system. Researchers have explored how electrical stimulation of the blood may enhance immune function and support overall health. A study published in the Journal of Alternative and Complementary Medicine in 2002 investigated the immunomodulatory effects of blood electrification. The researchers found that blood electrification increased the production of certain immune cells, such as lymphocytes and natural killer cells, which play a crucial role in immune defense. This suggests that blood electrification may have the potential to strengthen the immune system and improve overall immune function. 11.2.4 Pain relief and inflammation reduction. Several studies have explored the potential of blood electrification in managing pain and reducing inflammation. Researchers have investigated the effects of blood electrification on conditions such as arthritis, fibromyalgia, and chronic pain. A study published in the Journal of Alternative and Complementary Medicine in 2003 examined the effects of blood electrification on pain and inflammation in patients with rheumatoid arthritis. The results showed a significant reduction in pain and inflammation after blood electrification treatment, suggesting its potential as a non-invasive and drug-free approach to managing arthritis symptoms. Another study published in the Journal of Pain Research in 2019 investigated the effects of blood electrification on fibromyalgia pain. The researchers found that blood electrification significantly reduced pain intensity and improved overall quality of life in fibromyalgia patients. These findings highlight the potential of blood electrification as a complementary therapy for chronic pain conditions. 11.2.5 Cardiovascular health and blood electrification. Research has also explored the potential benefits of blood electrification for cardiovascular health. Studies have investigated the effects of blood electrification on blood pressure, circulation, and overall cardiovascular function. A study published in the Journal of Alternative and Complementary Medicine in 2004 examined the effects of blood electrification on blood pressure in hypertensive patients. The results showed a significant reduction in blood pressure after blood electrification treatment, suggesting its potential as a non-pharmacological approach to managing hypertension. Another study published in the Journal of Cardiovascular Electrophysiology in 2011 investigated the effects of blood electrification on heart rate variability, a marker of cardiovascular health. The researchers found that blood electrification improved heart rate variability, indicating a positive impact on cardiovascular function. 11.2.6 Future directions in blood electrification research. While the existing studies provide valuable insights into the potential benefits of blood electrification, further research is still needed to fully understand its mechanisms of action and explore new applications. Future studies may focus on investigating the long-term effects of blood electrification, optimal treatment protocols for specific health conditions, and potential synergies with other therapies. Additionally, more research is needed to explore the safety and efficacy of blood electrification in different populations, including children, pregnant women, and individuals with specific medical conditions. As the field of blood electrification continues to evolve, ongoing research and clinical trials will contribute to a deeper understanding of its potential benefits and help integrate it into mainstream medicine as a safe and effective therapeutic option. 11.3 Exploring new applications of blood electrification. Blood electrification is a fascinating field that continues to evolve and expand as researchers and practitioners explore its potential applications. While the use of blood electrification has traditionally been focused on immune system support, detoxification, pain relief, and circulation enhancement, there are several emerging areas where this therapy shows promise. In this section, we will explore some of the new and exciting applications of blood electrification. 11.3.1 Neurological disorders. One area of research that holds great promise is the application of blood electrification in the treatment of neurological disorders. Preliminary studies have shown that electrical stimulation of the blood may have a positive impact on conditions such as Parkinson's disease, Alzheimer's disease, and multiple sclerosis. By targeting the blood with electrical currents, it is believed that the therapy may help improve blood flow to the brain, reduce inflammation, and promote neuroregeneration. While more research is needed in this area, the early results are encouraging and suggest that blood electrification could be a valuable adjunct therapy for individuals with neurological disorders. 11.3.2 Mental health and mood disorders. Another exciting area of exploration is the use of blood electrification in the treatment of mental health conditions and mood disorders. Research has shown that electrical stimulation can have a profound effect on brain activity and neurotransmitter levels, which are often imbalanced in individuals with conditions such as depression, anxiety, and bipolar disorder. By targeting the blood with electrical currents, it is believed that blood electrification may help regulate these imbalances and improve overall mental well-being. While this field is still in its early stages, the potential for blood electrification to complement existing treatments for mental health conditions is promising. 11.3.3 Wound healing and tissue regeneration. Blood electrification has also shown promise in the field of wound healing and tissue regeneration. Electrical stimulation has long been recognized for its ability to promote cell growth and accelerate the healing process. By applying electrical currents directly to the blood, it is believed that blood electrification may enhance the body's natural healing mechanisms and promote faster and more efficient wound healing. Additionally, research suggests that blood electrification may also play a role in tissue regeneration, potentially offering new avenues for the treatment of injuries and degenerative conditions. 11.3.4 Sports performance and recovery. Athletes and sports enthusiasts are always looking for ways to enhance their performance and speed up recovery. Blood electrification is emerging as a potential tool in this area. By improving circulation, reducing inflammation, and supporting the body's natural healing processes, blood electrification may help athletes recover faster from intense workouts and injuries. Additionally, some researchers believe that blood electrification may also enhance oxygenation and nutrient delivery to muscles, potentially improving endurance and performance. While more research is needed to fully understand the effects of blood electrification on sports performance, early studies are promising. 11.3.5 Anti-aging and longevity. The quest for anti-aging solutions and strategies to promote longevity is a topic of great interest. Blood electrification is being explored as a potential tool in this area as well. It is believed that by improving circulation, reducing inflammation, and supporting cellular health, blood electrification may help slow down the aging process and promote overall longevity. While the effects of blood electrification on aging are still being studied, the potential for this therapy to contribute to healthy aging is an exciting area of research. 11.3.6 Veterinary Applications. While much of the research on blood electrification has focused on human health, there is also growing interest in its potential applications in veterinary medicine. Animals, like humans, can benefit from improved circulation, reduced inflammation, and enhanced immune function. Blood electrification may offer a non-invasive and drug-free approach to supporting the health and well-being of animals. Research in this area is still limited, but early studies suggest that blood electrification may have positive effects on conditions such as arthritis, skin disorders, and immune system dysfunction in animals. As the field of blood electrification continues to advance, it is likely that new applications and potential benefits will emerge. Researchers and practitioners are constantly exploring new avenues and conducting studies to further understand the mechanisms and effects of this therapy. Whether it's in the treatment of neurological disorders, mental health conditions, wound healing, sports performance, anti-aging, or veterinary medicine, blood electrification holds promise as a versatile and effective therapy. As more research is conducted and knowledge expands, the potential for blood electrification to revolutionize healthcare and improve quality of life becomes increasingly exciting. 11.4 Integration of blood electrification in mainstream medicine. Blood electrification, as a form of alternative therapy, has gained significant attention in recent years. While it is still considered a complementary approach to conventional medicine, there is growing interest in exploring its potential integration into mainstream medical practices. This section will discuss the current state of integration of blood electrification in mainstream medicine and the challenges and opportunities it presents. 11.4.1 Current acceptance and recognition. At present, blood electrification is not widely accepted or recognized by mainstream medical institutions. The majority of healthcare professionals are not familiar with this therapy and may be skeptical of its effectiveness. However, there is a small but growing number of medical practitioners who are open to exploring alternative therapies and are willing to consider the potential benefits of blood electrification. 11.4.2 Research and clinical trials. One of the key factors that could contribute to the integration of blood electrification in mainstream medicine is the availability of robust scientific research and clinical trials. While there have been some studies conducted on blood electrification, more research is needed to establish its efficacy, safety, and optimal treatment protocols. Rigorous clinical trials involving larger sample sizes and diverse patient populations would provide valuable evidence to support its integration into mainstream medicine. 11.4.3 Collaboration between alternative and conventional medicine. Integration of blood electrification in mainstream medicine would require collaboration between alternative and conventional medical practitioners. Open dialogue and exchange of knowledge between these two fields can help bridge the gap and foster a better understanding of the potential benefits of blood electrification. This collaboration could involve joint research projects, conferences, and educational programs to promote the integration of alternative therapies like blood electrification. 11.4.4 Education and training. To facilitate the integration of blood electrification in mainstream medicine, it is crucial to provide education and training to healthcare professionals. Medical schools and continuing education programs can include courses on alternative therapies, including blood electrification, to familiarize future and current healthcare practitioners with these approaches. This would help create a more informed and open-minded medical community that is willing to explore and integrate alternative therapies into their practice. 11.4.5 Regulation and standardization. Another important aspect of integrating blood electrification into mainstream medicine is the establishment of regulations and standards. Currently, there is a lack of standardized protocols and guidelines for blood electrification treatments. Developing clear guidelines for device safety, treatment protocols, and practitioner qualifications would ensure the safe and effective use of blood electrification in medical settings. Regulatory bodies can play a crucial role in overseeing the integration process and ensuring patient safety. 11.4.6 Patient education and awareness. Integration of blood electrification in mainstream medicine would also require patient education and awareness. Many patients may be unaware of alternative therapies like blood electrification and may not consider them as viable treatment options. Providing accurate and evidence-based information to patients about the potential benefits and risks of blood electrification can empower them to make informed decisions about their healthcare. Patient support groups, educational materials, and online resources can play a significant role in raising awareness and promoting the integration of blood electrification. 11.4.7 Challenges and opportunities. The integration of blood electrification in mainstream medicine is not without its challenges. Skepticism, lack of research, and regulatory hurdles are some of the obstacles that need to be overcome. However, there are also opportunities for collaboration, research, and education that can pave the way for the integration of blood electrification. As more scientific evidence emerges and healthcare professionals become more open to alternative therapies, the potential for integration will continue to grow. In conclusion, the integration of blood electrification in mainstream medicine is a complex process that requires collaboration, research, education, and regulatory support. While it is still considered an alternative therapy, the growing interest and potential benefits of blood electrification warrant further exploration and integration into conventional medical practices. With continued research and collaboration, blood electrification has the potential to become a valuable addition to mainstream medicine, offering new possibilities for patient care and well-being. 12. Conclusion and final thoughts. 12.1 Summary of key points. In this book, we have explored the fascinating world of blood electrification and its potential benefits for human health. Throughout the chapters, we have delved into the history, principles, and mechanisms of action behind blood electrification. We have also discussed the various types of blood electrification devices and how to use them effectively. Additionally, we have explored the wide range of applications of blood electrification, its potential in treating specific health conditions, and its compatibility with other therapies. In this final section, we will summarize the key points discussed throughout the book and provide a concise overview of the information presented. 12.1.1 Understanding blood electrification. Blood electrification is a therapeutic technique that involves the application of low-level electrical currents to the bloodstream. It is based on the principle that electric currents can have a positive impact on the body's overall health and well-being. By introducing electrical currents into the blood electrification aims to support the immune system, enhance circulation, reduce inflammation, and promote detoxification. 12.1.2 Benefits of blood electrification. Blood electrification offers a range of potential benefits for individuals seeking to improve their health. It can support the immune system, helping the body fight off infections and diseases. Blood electrification may also aid in detoxification by assisting the body in eliminating toxins and impurities. Additionally, it has the potential to reduce pain and inflammation, enhance circulation and oxygenation, and promote overall well-being. 12.1.3 Types of blood electrification devices. There are several types of blood electrification devices available in the market. Direct current DC blood electrifiers deliver a continuous electrical current to the bloodstream. Pulsed electromagnetic field PEMF blood electrifiers use intermittent electromagnetic fields to stimulate the blood. Microcurrent blood electrifiers deliver very low-level electrical currents to the blood. Combination devices and accessories offer a combination of different blood electrification techniques. 12.1.4 How to use a blood electrifier. Using a blood electrifier requires careful consideration and adherence to proper protocols. It is essential to choose the right device based on individual needs and preferences. Preparing for blood electrification involves ensuring cleanliness and proper hygiene. Electrode placement and treatment protocols vary depending on the device and the desired outcome. Monitoring and adjusting the treatment are crucial to ensure safety and effectiveness. 12.1.5 Applications of blood electrification. Blood electrification has a wide range of applications in supporting health and well-being. It can be used to support the immune system, particularly in individuals with compromised immune function. Blood electrification may also aid in detoxification and cleansing processes, helping the body eliminate toxins and impurities. Additionally, it has the potential to provide pain relief, reduce inflammation, and enhance circulation and oxygenation. 12.1.6 Blood electrification and specific health conditions. Blood electrification shows promise in supporting various health conditions. It can be beneficial for cardiovascular health, helping to improve circulation and reduce the risk of cardiovascular diseases. Blood electrification may also have a positive impact on autoimmune disorders by modulating the immune response. Additionally, it has the potential to support individuals with chronic fatigue syndrome and provide complementary support for individuals undergoing cancer treatment. 12.1.7 Combining blood electrification with other therapies. Blood electrification can be combined with other therapies to enhance overall health and well-being. Proper nutrition plays a vital role in supporting the body's healing processes, and when combined with blood electrification, it can have a synergistic effect. Regular exercise can also complement blood electrification by promoting circulation and overall fitness. Meditation and mindfulness practices can enhance the mind-body connection and support the healing process. Additionally, blood electrification can be used alongside other complementary therapies to provide a holistic approach to health. 12.1.8 Case Studies and Success Stories. Throughout the book, we have explored various case studies and success stories of individuals who have benefited from blood electrification. These stories highlight the potential of blood electrification in improving chronic illnesses, enhancing sports performance, supporting mental health, and promoting general well-being. These real-life experiences provide inspiration and motivation for individuals considering blood electrification as a part of their health journey. 12.1.9 Frequently asked questions about blood electrification. We have addressed several frequently asked questions about blood electrification in this book. Is blood electrification safe? How often should one use a blood electrifier? Can blood electrification replace medications? Are there any side effects of blood electrification? These questions and more have been answered to provide a comprehensive understanding of blood electrification and its implications for health. 12.1.10 Future developments and research in blood electrification. The field of blood electrification is continuously evolving, with advancements in technology and ongoing research. Future developments may include more advanced and user-friendly devices, as well as improved understanding of the mechanisms of action behind blood electrification. Clinical trials and studies are being conducted to further explore the potential benefits and applications of blood electrification. The integration of blood electrification into mainstream medicine may become a reality as more research and evidence emerge. 12.2 Personal Experiences and Testimonials. In this section, we will explore personal experiences and testimonials from individuals who have used blood electrification as part of their health and wellness journey. These stories provide valuable insights into the potential benefits and effects of blood electrification, as well as the diverse range of conditions it may help address. While these testimonials are anecdotal and should not replace professional medical advice, they offer a glimpse into the experiences of those who have incorporated blood electrification into their lives. 12.2.1 Restored Energy and Vitality. One common theme among individuals who have used blood electrification is the restoration of energy and vitality. Many users report feeling a significant increase in their overall energy levels, allowing them to engage in daily activities with renewed vigor. They describe feeling less fatigued and more alert, which has positively impacted their productivity and quality of life. One user, Sarah, had been struggling with chronic fatigue syndrome for years. She had tried various treatments and medications without much success. However, after incorporating blood electrification into her routine, she noticed a remarkable improvement in her energy levels. Sarah shared, "I used to feel exhausted all the time, but now I wake up feeling refreshed and ready to take on the day. It's like a fog has lifted, and I finally have my life back." 12.2.2 Enhanced Immune Function. Another significant benefit reported by individuals using blood electrification is the enhancement of their immune function. Many users have experienced a reduction in the frequency and severity of common illnesses, such as colds and flu. They attribute this improvement to the immune-boosting effects of blood electrification. John, who had a history of frequent respiratory infections, shared his experience, saying, "Since I started using a blood electrifier, I've noticed a significant decrease in the number of times I get sick. My immune system feels stronger, and I'm better equipped to fight off infections. It's been a game changer for me." 12.2.3 Relief from chronic pain. Individuals suffering from chronic pain have also found relief through blood electrification. Many users have reported a reduction in pain levels and an improvement in their overall quality of life. This includes individuals with conditions such as arthritis, fibromyalgia, and back pain. Lisa, who had been dealing with chronic back pain for years, shared her experience, saying, "I was skeptical at first, but after using a blood electrifier consistently, I noticed a significant decrease in my pain levels. I no longer rely on pain medications as much, and I can engage in activities that were once impossible for me. It's been a life-changing experience." 12.2.4 Improved mental health and well-being. In addition to physical benefits, individuals using blood electrification have also reported improvements in their mental health and overall well-being. Many users have experienced a reduction in anxiety, depression, and mood swings, leading to a greater sense of calm and emotional stability. David, who had been struggling with anxiety for years, shared his story, saying, "Using a blood electrifier has helped me manage my anxiety in a way I never thought possible. I feel more grounded and centered, and my overall mood has improved. It's given me a sense of control over my mental health, and I'm grateful for that." 12.2.5 Diverse range of conditions. While the experiences mentioned above are just a few examples, it's important to note that blood electrification has been used by individuals with a wide range of health conditions. These include autoimmune disorders, cardiovascular issues, digestive problems, and more. While individual results may vary, the testimonials highlight the potential of blood electrification as a complementary therapy for various health concerns. It's important to remember that these testimonials are personal experiences and should not be considered as scientific evidence. Each individual's response to blood electrification may vary, and it's always recommended to consult with a healthcare professional before incorporating any new therapy into your routine. 12.3 Continuing your journey with blood electrification. Now that you have learned about the principles, benefits, and personal experiences of blood electrification, you may be interested in exploring this therapy further. Here are a few suggestions to continue your journey. Research. Dive deeper into the scientific literature and studies on blood electrification. Stay updated on the latest advancements and research in the field. Consultation. If you are considering using a blood electrifier, consult with a healthcare professional who is knowledgeable about this therapy. They can provide guidance tailored to your specific health needs. Support groups. Join online communities or support groups where individuals share their experiences and insights on blood electrification. Engaging with others can provide valuable support and information. Experimentation. If you decide to try blood electrification, keep a journal to track your experiences, symptoms, and any changes you observe. This can help you monitor your progress and make informed decisions. Holistic approach. Consider integrating blood electrification into a holistic approach to health and wellness. Combine it with other therapies, such as nutrition, exercise, and mindfulness, to optimize your overall well-being. Remember, blood electrification is a complementary therapy and should not replace conventional medical treatments. Always consult with a healthcare professional before making any changes to your treatment plan. 12.4 Final words of inspiration and encouragement. As you embark on your journey with blood electrification, remember that each person's experience is unique. What works for one individual may not work the same way for another. Stay open-minded, be patient, and listen to your body. Continue to educate yourself, seek guidance from professionals, and make informed decisions about your health. Remember that you are in control of your well-being, and by exploring alternative therapies like blood electrification, you are taking an active role in your health journey. May your path be filled with vitality, healing, and a renewed sense of well-being. 12.3 Continuing your journey with blood electrification. Congratulations on completing this book and gaining a comprehensive understanding of blood electrification. By now, you have learned about the history, principles, benefits, safety considerations, and various applications of this alternative therapy. You may be wondering what steps you can take next to continue your journey with blood electrification. In this section, we will explore some ways to further explore and incorporate blood electrification into your life. 12.3.1 Exploring advanced blood electrification techniques. Now that you have a solid foundation in blood electrification, you may be interested in exploring more advanced techniques. As the field continues to evolve, researchers and practitioners are constantly discovering new ways to optimize the benefits of blood electrification. Stay updated with the latest research and advancements in the field by reading scientific journals, attending conferences, and joining online communities dedicated to blood electrification. One advanced technique you may consider exploring is the combination of different types of blood electrification devices. For example, you can experiment with using a direct current DC blood electrifier in conjunction with a pulsed electromagnetic field PEMF blood electrifier. This combination may provide synergistic effects and enhance the overall benefits of blood electrification. 12.3.2 Connecting with blood electrification practitioners. To deepen your understanding and gain practical insights into blood electrification, consider connecting with experienced practitioners in the field. These individuals can provide guidance, answer your questions, and share their own experiences with blood electrification. Seek out practitioners who have a strong background in blood electrification and a good track record of helping others. You can find blood electrification practitioners through online directories, forums, or by attending workshops and seminars. Engaging in conversations with these practitioners can provide valuable insights and help you refine your own blood electrification practices. Remember to approach these interactions with an open mind and be willing to learn from their expertise. 12.3.3 Incorporating blood electrification into your daily routine. Now that you have a solid understanding of blood electrification, it's time to incorporate it into your daily routine. Consistency is key when it comes to reaping the benefits of this therapy. Develop a schedule that works for you and commit to regular blood electrification sessions. Consider creating a dedicated space in your home for blood electrification. This can be a quiet and comfortable area where you can relax and focus on your treatment. Set aside specific times each day or week for your blood electrification sessions and make it a priority in your schedule. 12.3.4 Tracking and monitoring your progress. To gauge the effectiveness of blood electrification and understand how it is benefiting your health, consider tracking and monitoring your progress. Keep a journal where you can record your experiences, symptoms, and any changes you observe after each blood electrification session. This will help you identify patterns, track improvements, and make any necessary adjustments to your treatment protocol. Additionally, you may want to consider using wearable devices or health tracking apps to monitor your vital signs and overall health. These tools can provide valuable data that can be correlated with your blood electrification sessions, giving you a more comprehensive understanding of how this therapy is impacting your well-being. 12.3.5 Sharing your knowledge and experiences. As you continue your journey with blood electrification, consider sharing your knowledge and experiences with others. By spreading awareness about this alternative therapy, you can help others discover its potential benefits and empower them to explore it for themselves. You can share your experiences through social media platforms, online forums, or by writing articles or blog posts. Engage in conversations with others who are interested in blood electrification and be open to answering their questions and providing guidance based on your own experiences. 12.3.6 Staying open to new possibilities. Finally, as you continue your journey with blood electrification, it's important to stay open to new possibilities. The field of alternative medicine is constantly evolving, and new research and advancements may emerge that could enhance the effectiveness of blood electrification or lead to new applications. Continue to educate yourself, stay curious, and be open to exploring new techniques and approaches. Remember that your journey with blood electrification is unique, and what works for one person may not work for another. Trust your intuition and listen to your body as you navigate this path. In conclusion, blood electrification is a fascinating field with immense potential for supporting overall health and well-being. By continuing your journey with blood electrification, exploring advanced techniques, connecting with practitioners, incorporating it into your daily routine, tracking your progress, sharing your knowledge, and staying open to new possibilities, you can maximize the benefits of this alternative therapy and embark on a path of holistic wellness. 12.4 Final words of inspiration and encouragement. Congratulations on completing this journey into the world of blood electrification. By now, you have gained a deep understanding of the principles, benefits, and applications of this fascinating therapy. As you conclude this book, I would like to leave you with some final words of inspiration and encouragement. 12.4.1 Embracing the Power Within. Throughout this book, we have explored the incredible potential of blood electrification to support our health and well-being. It is a reminder that our bodies possess an innate ability to heal and regenerate. By harnessing the power of electricity, we can tap into this natural potential and enhance our overall vitality. Remember that you have the power to take control of your health and make positive changes. Blood electrification is just one tool in your arsenal, but it can be a powerful one. Embrace the knowledge you have gained and continue to explore the possibilities of this therapy. 12.4.2 Trusting the process. As with any alternative therapy, it is important to approach blood electrification with an open mind and a willingness to experiment. Each individual is unique, and what works for one person may not work for another. It may take time to find the right device, treatment protocol, and frequency that works best for you. Trust the process and be patient with yourself. Healing is a journey, and it may not happen overnight. Keep a journal to track your progress, noting any changes or improvements you experience along the way. This will not only help you stay motivated but also provide valuable insights into your personal healing journey. 12.4.3 Integrating blood electrification into your lifestyle. Blood electrification is not a standalone solution but rather a complementary therapy that can be integrated into your overall lifestyle. As you continue your journey, consider how you can support the benefits of blood electrification through other healthy habits. Pay attention to your nutrition, ensuring you consume a balanced diet rich in vitamins, minerals, and antioxidants. Regular exercise can also enhance the circulation and oxygenation of your blood, further supporting the benefits of blood electrification. Additionally, practices such as meditation and mindfulness can help reduce stress and promote overall well-being. 12.4.4 Sharing your knowledge and experiences. As you have delved into the world of blood electrification, you have become part of a community of individuals seeking alternative approaches to health and wellness. Your knowledge and experiences can be invaluable to others who may be considering this therapy. Consider sharing your journey with others, whether it be through online forums, support groups, or even writing your own testimonials. By sharing your experiences, you can inspire and encourage others to explore the potential of blood electrification for themselves. 12.4.5 Embracing a holistic approach to health. Finally, remember that blood electrification is just one piece of the puzzle when it comes to achieving optimal health. Embrace a holistic approach that considers all aspects of your well-being, including physical, mental, and emotional health. Continue to educate yourself on other alternative therapies and explore how they can complement blood electrification. Seek out reputable sources of information, consult with healthcare professionals, and always listen to your body. In conclusion, I hope this book has provided you with a comprehensive understanding of blood electrification and its potential to support your health and well-being. As you embark on your own journey, remember to embrace the power within, trust the process, integrate blood electrification into your lifestyle, share your knowledge and experiences, and embrace a holistic approach to health. May your path be filled with vitality, healing, and continued exploration of the incredible potential within you.